morning. Today is Tuesday, July the 26th, 2020. Okay. (2022). It is a Board of County Commissioners work session, and we are, first item on our agenda for our work session this morning is we're going to discuss board appointments. And I'm going to start with the animal shelter. We have Michael Fox, who was interviewed on July 12th, and Allison Richmond, who was interviewed on Michelle Fox, and Allison Richmond interviewed on June 29th. So we have, yes?
Make sure they kill the music. The music's still on behind you. It's like you're rapping along to that music.
I don't hear the music, so I've got the beat wrong here, so. Thanks, Greg. Just so you know, in a moment, Kelly and Francie and I are going to get up and dance.
On the table.
On the tabletop. Are we good? Greg, is it good now?
I like it better with the music.
Okay. So we have Animal Shelter. Michelle Fox and Allison Richmond were our two interviewees for this appointment. So we have one position available. Does the board want to have any comments or suggestions?
I will.
Yes, Kelly.
Yeah, I'd like for us to consider Allison's, for the appointment. I had learned after the interview, and I think Allison's very qualified. I really liked her spirit and energy related to her commitment to the shelter. And then I also learned after the interviews that Michelle has her own kennel and that she runs, and I thought that was pretty poignant information to not share with us during the interview process, and so that just sort of bothers me a little bit. So all things considered, I think I would prefer to appoint Allison.
Any other comments from the board?
Yeah, Allison's the second one, right?
Mhm.
Yes, I would like to appoint her.
Steve, Greg?
Could everybody make sure your mics are turned on? Everybody's kind of muted. You're okay, Patty, but.
Sorry, Steve. Can you hear us now?
You were quiet.
Well, Francis.
Who was the second person we interviewed more recently?
The second one was Allison.
Oh, was that?
Are you sure it wasn't Michelle was the second person we interviewed? I think
No, it's,
Michelle was the
oh
second
yeah, you're
one.
right. Allison was the,
Yikes. Better get this right.
it says Allison was
Allison
interviewed
was
on
the
the
first one.
29th. Allison was interviewed and we didn't have a spot. Was that correct?
No, there was a spot available and it was advertised and we had two people apply for it.
No, I think this was prior to that. So Kelly, which one are we?
Yeah, I was hoping to to appoint the second interviewee that we.
Well, that would have been
interviewed
Michelle.
last week.
That's Michelle.
Okay,
well,
thanks
then
for
I
that
would go with
correction,
Michelle.
Greg.
Yeah, sorry guys. Yeah, Allison was on the 29th of June and Michelle was on July 12th.
Right.
Glad we cleared that up. Greg, you knew Allison, right? She's the one you know or know about?
No, I don't know either of them. I've never met either of them.
But
Okay.
but you knew something about the first one, and you think that was Allison?
Yeah, and the thing that I got, just quite honestly, from the first interview with Allison is she reiterated several times that she's a dog person and not a people person. And this is a board position where you have to interact and deal with people. And I got a sense that she really wasn't particularly comfortable with that. And I'll just leave it at that.
Okay, so I think what was confusing is I brought up Michelle first and she was actually the second interview. and Allison was the first person we interviewed. And I agree with Kelly and Francie that I think Michelle would be a great fit because of all the time and energy she already puts in at the shelter. And
I agree with that.
Yeah, I would too.
Okay.
Great.
Our second
Thanks
one
for the
is
clarifications.
much easier. We have one, Christine McKelvey, who was interviewed on July 12th. She's our only person that we interviewed as an applicant for the senior council. And we always appreciate people applying for senior council because we always have space on that board.
I thought she was great.
Yeah.
It would be really good on the board.
So is the board good? Okay, so then we'll
Yep.
okay, we'll put Christine on there. And Basalt Library Board, both you and Steve and Francie, you interviewed. And,
Eric.
but we don't have a name or,
Palander.
who was?
Eric Palander. It's E-R-E-C, Eric Palander, P-E-L-L-A-N-D-E-R.
Okay, we need to make sure we get that info to Charlotte so she can put it on. And is the board comfortable then in appointing this person to the Basalt Library Board?
I definitely am.
Yeah.
I liked him a lot.
Yes, me too.
Okay.
Yes.
So we'll put that one on our list, because I don't know if we're gonna be bringing it back tomorrow as part of our regular meeting. Now, the last one is the APCHA. We had a renewal for John Ward, and we had a new applicant, Chris Council, who'd been previously on the APCHA board. And then after, or about this same time, we were gonna interview those two gentlemen. Dave Loughran, who was an alternate, he moved out of Pickens County, so he resigned, which created now an open seat, even though it's an alternate seat, on the APCHA board. I had suggested when we were having our joint meeting with City Council that we move John Ward, keep him, approve his renewal to the APCHA board, and then possibly open up the application process again for the public now that this seat is an open seat. Kind of, I think, puts people in a different thing than applying for something that's where somebody's applying for a renewal. And we may get some different applicants that we may want to interview. Chris Council did a great interview with us at the joint meeting, so I just want to see what the board would like to do.
I'd agree with you, Patty.
Yeah, me too. And, I mean, I agree too with opening up the application process again. Chris Council had a very good interview, and he did serve on APCHA before, so if no one else applied, I'd feel fine appointing him, but if other people apply, then we need to interview them before appointing Chris.
Okay, and this would be also dependent upon where City Council lands on this, because this is a joint issue between the two of us. Kelly?
Yeah, I just want to clarify what I think I hear. So we would recommend to City Council to reappoint John Ward for his current position, and then we would go back out for a application process for the alternate position. Is that what I
Right,
hear?
and,
Okay.
and let Chris, if Chris wants to stay in that
Sure.
category,
Yeah.
yeah. 'Cause
I don't think we'd have to re-interview Chris, though, would we?
no, I don't
Okay.
think so, unless the city chose to, so, are you comfortable with that?
Yeah,
Francie?
and I'll just say, you know, John Ward's experience in banking, I find to be really helpful at the APCHA board. Like when we have conversations related to, you know, maintenance, whether it's maintenance of the common areas or whether it's maintenance of individual units, like he just brings a lot about financing and you know, people's equity that they've built over time and how tools that they can access that really informs our conversations while we work through those programs.
So Greg, Francie, you okay with the process, or?
Yeah, I am. I would also be okay with appointing Chris. I know he likes to be part of public service, and he has some history with APCHA, so I wouldn't have a problem with appointing him, but it looks like the majority want to recommend to open it up again, so I'm also okay with that.
Let's just see if there's any other members of the public. Greg, you okay?
Yes, I approve of that.
So we'll have Charlotte send back to the city council this decision that we would support reappointing John Ward for his renewal, and that we would keep Chris Council in mind for the alternate seat that is now an open seat, and we would like to open up the application process again for a certain period of time, not months, to see if there's any members of the public that might be interested now in applying, because it's not a renewal seat, it's an open seat.
And I will just share, you know, I've found the attendance at APSHA to be good for the most part. You know, I don't feel like we've had to really rely on
The alternate.
Yeah, all the time.
On
I don't
what?
know if you
The
agree
alternate.
with that.
Oh, yeah.
Yeah, I mean, but everybody is usually there. You know, most people are usually there, so the alternates are really contributing to the conversation the whole time
great.
too.
And the alternates can only be alternates for whom they're appointed to be an alternate, right? Like if you
Yeah.
don't have a quorum, but you're there and I'm there, I can't represent somebody else who's not there. Isn't
That's
that
right.
correct?
Yeah.
Right.
Yeah, okay.
Okay. Well, I'm so glad I rushed everybody into this. I promise
I
I
can have
won't
a
have
longer
coffee
lunch.
for lunch, since I don't drink coffee anyway, and I will avoid the chocolate for lunch, and hopefully we'll have a calmer rest of the day. But then
Did
there's
you want to
always
do any
tomorrow.
future agendas or
Um,
anything like that?
We could.
If we could, anything to get me on the road a little bit early.
But
Oh, well, we still have to
We
go with
still have
planning
4 to
and
6
zoning.
with
Yeah.
with the P and Z. We could, is there any items for, actually, we're not even gonna do, oh yeah, future agendas. Is there anything? Phyllis is searching quickly.
I don't think I can get it. I have to run upstairs.
Or we
What
can
was
wait,
that
it's
sound?
fine.
Does the board, well, Phyllis, if you want to, let's see if the board has any. Does the board have anything for future agendas?
Patty, what was decided about August 2nd, Tuesday?
August 2nd, well,
That's a good question.
we had nothing scheduled, so I made an executive decision and canceled. And then, of course, people came forward and said they wanted to put things on, but we'd already taken it off the agenda. We do have some open time coming up on the 9th, I believe. So if anybody has any items they would like to put on the 9th.
So we don't have a meeting next Tuesday.
We don't have a meeting next Tuesday. I will be out anyway, but it's not a reason to not have the meeting, because Francie could definitely handle it. But I know, Kelly, you had wanted to see if we could get, the director from APSHA.
Yeah,
But-
and that, you know, that can happen on the 9th.
If he's available.
Yeah.
If he's available, it looks like we might have time on the 9th. But I think staff was wondering, what was the question? Was it supposed to be a joint meeting with the APSHA board and him, or what?
No, I think what had come out of our initial conversation from a while ago was to have APSHA come before us and I think present some of the data that Francie and I have seen, and also just answer questions that this board has clarifying the rules
So would you like an hour?
for that. So, yeah, I think an hour.
I think it'd be really great,
Yeah.
because that way we don't have to have board members answering questions all the time instead of.
So
staff.
it'll be
Sure.
APSHA staff,
Mhm.
director and
Um,
staff.
It'll be Matthew, I think. I mean,
I think Cindy and Bethany should probably also be invited, just because if we have questions about the rules, they're gonna be more familiar.
Okay.
And I guess on that note, I would just say, in terms of prep, it would probably be helpful if people started creating their questions.
I don't really have any. I
Ahead of
don't think
time.
mine will have to come out of what I hear.
Yeah.
So you want them to present, so just so when we contact APSHA and let them know, we can tell them what we're looking for.
Yeah, I mean, I just think if people do have questions already about what particular rules they'd like to understand better with APSHA, it'd be helpful for that staff to know, for them to know ahead of time.
Okay, but what else do you
So-
want APSHA to present? You said you wanted them to present some information.
Yeah, I think they should present the data that we've learned about the inventory as far as you know, the number of units, the different categories, the number of
So
bed.
data regarding inventory
utilization,
and then open for questions?
you know, the information that we track with regards to lotteries and length of time people have worked here who are winning lotteries. things like
So
that.
who, if the members of the Board of Commissioners have questions, who should they direct those to have preparation for this meeting on the 9th?
You want to go to Charlotte to coordinate them, or?
I don't know I mean, is Ashley involved in this at all, or who would help prep that meeting, I guess?
You know, while we're working, we'll find out.
Okay,
Okay,
and
so
I'm
you-
always happy
Can
to
you,
take
can
them
you help with that? Because I'm
too,
not sure.
but-
Yeah, we'll
Yeah.
identify somebody.
Okay.
Okay.
So any assistance from Kelly and Francie would be great.
Mm-hmm.
So that's for the 9th.
Okay, and I have a question about this August 2nd thing we got from Charlotte about instead the thing with Bennett, which is the 8th, so I don't quite see the connection.
I don't know what you're talking about.
So a letter that came from Charlotte that said you'd be talking about that today, Phyllis?
That's probably open discussion.
But it's also agenda.
Yeah.
Yeah.
So that was to meet with,
Hillary.
I can't remember her first name, her
Hillary.
last name is Henry.
Hillary.
Henry, she's Kathy Chandler Henry's daughter.
Oh, she is? I didn't know
Yeah,
that.
but-
She is Michael Bennett's aide, and she will be meets with any constituent in Aspen who wants to meet with her periodically, and I guess that's on Monday, and that would be our opportunity if we wanted to meet with her to discuss any issues we'd want to talk about.
On Monday's the
The
1st.
8th, the 8th.
Oh, Monday the 8th?
And John thought if there was anything about the airport, that might be a good opportunity to discuss.
Okay, I don't know what I'm doing on Monday the 8th yet. That's,
It's Monday the 8th from 1:30 to 3:30 in Aspen City Hall.
Oh, I see, and Charlotte just sent us this thing about she would notice it on the second agenda, August 2nd agenda, and
Well,
also,
along with it being canceled on
right,
that page.
yeah, okay, I get it.
And then it's to schedule an appointment, so if you'd like to do that, and there's 3 people that want to.
yeah, let's go ahead and notice it because we don't know who might want to show up.
So let's notice it,
Yeah,
and
yeah. We'll get it on our agenda so we remember. And then,
do you want us to schedule, find a time?
do we have to have a specific time?
Well, it says to schedule an appointment, email her. So let's see how that works.
Yeah.
And then we'll
And
find
then,
out.
because
And then
if
we'll just
Kelly
notice
and
it.
I met with Michael Bennett, Senator Bennett at the airport, so if Kelly and I want to follow up, we'll figure it out.
Okay.
Yeah, I think that, it could be
We'll do
helpful.
both. We'll
I mean, they
notice it.
have submitted a congressionally directed spending request on our behalf for moving the tower at the airport.
Yeah, so
and
let's,
doing the
maybe we can
energy
get
grid.
Dan Bartholomew in on this too, and Rich, and see if they want to either attend with us or give Kelly and I and whoever else some direction as to what we might want to update Senator Bennett's office with. How's that? Okay, thanks Francie for bringing that up. Okay, anything else on future agendas that we know of at this time?
And Charlotte must not be at her computer, 'cause
Okay,
I'm not getting
okay.
any.
Well, she's,
Anything fed to me.
we know where to find her. So I think right now we have some things coming up, but not till later in the month of August, so I don't think we need to worry about those right now.
No, my next non-attendance is the last Wolf meeting, which is great, unless there's one more in September, which there might be. And it is not showing up on here. Oh, yeah, there it is. It'll be Wednesday, the 24th.
Seemed like there was something coming up.
And depending on what's on our schedule that day, it's in Glenwood, so I could,
Yeah,
I don't know, figure it out, but if we leave it right now that I won't be there, then we can go from there. You know, hopefully that'll be the last one.
Okay.
seems like there was something happening on that.
I'm considering going to the Water Congress.
Yeah.
So you
the
might
end
on
of
the 24th?
August. Yes. I can like balance zooming in and all that from that, but I haven't fully decided. So
I
I'll
know, it's a
report back.
really
Let's
packed
put
day. I
you both
wanted to go
down
to.
with question marks so we know. Well, killing both with question marks. So, Phyllis, did you get that?
No.
Both Francie and Kelly may be out on Wednesday, August the 24th.
Okay.
And I have to look at my whole calendar to figure out when I'm doing it. I'll do that and let Charlotte know. Okay, anything else?
We'll put that there.
Greg, Steve, do you have any future agenda items, issues, concerns, questions, additions?
No, thanks.
I'm good.
Okay. And you're good?
I
Phyllis?
am, I'm not sure where this goes. We just wanted to let the board know about the moderator position that we have here. Michaela is the last of the 3 staff from the IT department that are still here.
Thank you.
Well, not that we're still here, Andrew's still
Well, Andrew got promoted, and so he was filling in this morning, so.
And
and solved
Michaela's
us.
taking a
And-
much-deserved vacation,
on vacation.
3 weeks.
Good for you.
So right now, we're trying to figure out how to best fill the position. Willoughby put his resignation in.
Oh, you did?
So we will not have, it's a long commute and not a lot of hours.
Oh. Where does he
So-
live?
I don't know,
Oh,
whatever's long. It's,
But the
it could
thing
be
is-
just be traffic, I don't know.
Yeah.
But the question posed to me was, do we need this person? And I said yes. So we have to figure out how to fund a position and find a position, or we have some creativity we might be thinking about. Because then we don't have to have the person who's chairing the meeting trying to run IT at the same time.
That would be good.
So, and plus you're invaluable to us. So we're gonna be working on that position as something maybe coming back for the board.
And yes, and in the near future, we may be getting creative to try and figure out that slot. We can always pull Andrew in. He's kind of our backup. But now as the manager in IT, he has other work than sitting here at the meeting. Sure.
Abby Cheney, who is part of the communications team, is also getting trained on moderating, so she'll be supporting us a lot, as well as we can loop in like Rosa potentially, and I think there can be collaboration between IT and the manager's office.
Good.
For more support intermittently while we're finding them.
Yeah, till we figure out a
Right, so
more definite solution.
And so they may not be as skilled sometimes. So we'll still be leaning on IT to run upstairs when we get problems. Just, we wanted to let the board just be aware of what we're trying to work through.
Would it, I don't know, is it possible to sort of outsource to to Grassroots or one of the AV companies or something in the temporary?
We haven't found that yet. We haven't found, at least through the temporary employment services, haven't found that.
I just mean the
But
contract
you're talking about the
with
companies,
them.
yeah.
Yeah,
That
for that service.
We can check there too.
Yeah, well,
My
I
husband works at Six
definitely, I wish
Productions
I could
now,
say I
so
was
can
capable.
connect you with-
Okay.
I don't
think
want
he
to
would
have
do
that
it.
responsibility next year. It's
thinking of you and
way too much. for
So
me.
like I was just saying, I wish I could say I was capable of doing all of it. After this morning, I'm not.
Yeah.
So, okay, all right. Phyllis, anything else, since we've
That's-
got a little more time?
That's all I have in my head.
Okay.
The rest is on my computer, and I didn't think when we
Okay.
came down from exec
Okay.
to grab
so-
it.
So we are back here at noon. No, we're not. We're back here at 1 o'clock. At 1 o'clock to start the rest of our afternoon, and then just for the public, the board from 4 to 6 is having a joint meeting with our Planning and Zoning Commission. It will also be on Grassroots, and we'll have a Zoom link with our regular work session. We're going to be discussing some goals and direction for our new Citizens Advisory Committee, which we will be approving at tomorrow's regular meeting. So that being said, I'm gonna look to the board and say, would you guys like to break for lunch now?
Sure.
Okay, so Grassroots, thank you. We'll be back at 1 o'clock.
Thanks, Patty.
Thank you.
Thank
Thanks,
you.
guys. Okay, we have cards we need to sign.
Yes, anniversary cards for the 20-year plus people.
So. Postman on board with us? Yes, we do. Okay,
I'm here.
count me down. You ready? Welcome back. Today is Tuesday, July the 26th, 2022. This is the Board of County Commissioners work session, and we are starting our afternoon agenda with the Aspen Ambulance District ballot discussion. So I have members of the staff. Why don't you guys come on up, and we'll have Phyllis kick us off.
I will. Phyllis Mattice, Deputy County Manager, while John Peacock is
In
out
Grand
of
Junction.
pocket today. And with me, Gabe Muthing, Director of the Ambulance District Department Service, all of those. Connie Baker, Budget Director, and Ann Driggers, Finance Director. So new to me, I have a brand new computer, so hopefully, as I work to share my screen, otherwise I'm gonna, okay, yep, and slideshow, I'm guessing, is there. Okay.
Great.
Oh, it goes ahead on me. I'll keep going. So just what the ambulance district is, give you a little background, and where they are financially is where we're going to end up, so we can discuss the revenues that are needed to sustain the ambulance district services into the future. So the department provides 24-hour pre-hospital emergency medical care. So in addition, they also provide it to both the community, to the hospital. They do prevention, education, also provide services to special events and emergency management. Anybody was at our vaccine clinics, as well as the beginning of COVID, when the incident management team was set up. Gabe is a member of that. So the current revenue model, there's patient charges, so people who have provided services, the tax income, and then additional revenue sources such as the special events fees and those things are not able to sustain the district ongoing with the cost of operations right now. And Gabe, I'm going to let you chime in anytime. I could probably let you do this because you're good at this.
I'll let you keep rolling.
Okay. So I'm going to go through operations volume, the physical operations. The last time we had a ballot question was in 2014, and the physical condition of the ambulance district was a biggie this time round. New building. You have one quick slide. So the department has been working on energy reductions, efficiency reductions, and operational organization for quite a while. The ambulance fleet, which is a huge expense, buying ambulances, have been reduced, and then you'll see here now that there's 4 ambulances, the EMS command vehicle, and then the second command vehicle that's also wildland capable.
And we actually left, what you see highlighted in there is a leftover from 2014. And I felt it important to leave that in there. If you notice, initially we had a fleet of 6 ambulances. We were using only a few miles a year for special events and things. So we really did make them efficient. But the one thing I really would like to call out is when we wrote this in 2014, if you notice that $150,000 per replacement for an ambulance is a dream now. A nightmare, if you will, too. Almost double, literally doubling that amount now for a new ambulance. Just a price we can't get away from, for sure.
And you only reduced by 2 ambulances, though. It looks like you reduced by 4.
No,
By
ma'am.
2,
No.
by 2.
Yep, we had a fleet of 6, and
Yeah.
we reduced, we got rid of 2 ambulances and now have a fleet of 4.
Yeah,
4
okay, great.
ambulances, yes.
Yeah, thank you for the tour, by the way. That was fantastic.
Loved having you.
I'll let you do this one.
Thanks. So this is a big one. So, first off, I think everybody's aware that last year, just due to the rapid increase in volume, and I think we've all seen that in every aspect of the community, just, rapid increases in visitors, in just events coming back, which we're so happy to have people here, but it's really put a stressor on our services. So in 2022, this year, we did increase our staff, so we now have 2 crews on 24/7, which really allows us to respond to any call, middle of the night, middle of the day. And what we were seeing is we were having multiple call failure. We were having multiple calls at the same time. And I know that sounds weird, but literally we joke that there's a gravity storm and people just all fall down at once. It's kind of funny. But we have to be able to respond to that. And so the best way to do that is to increase our staffing and have the ability to do that. Now, if it exceeds those 2 ambulances, we have other agreements in place with other fire and EMS agencies, Roaring Fork Fire. They will come up and help us, as we will go down and help them when they have the same issues. So it's a great relationship. But we really felt like that increase in staffing was needed. And so far, 2022 has been a stellar year for us, and we continue to go up in our volumes. And so that has been proven to be such a great thing to have. Again, as for equipment, we talked a little bit about the ambulances. They've really been maximized, with having the 4 ambulances. We also have the command vehicle. So now we have a structural model of response that really allows us to very rapidly respond to any emergency, do it efficiently, have the right amount of resources there, the right equipment there, to really provide the best care possible. I would love to tell you, and contrast and compare us to other smaller communities our size, but what we're doing here is absolutely amazing, and the level of care that we're able to provide. Part of that is the equipment and the resources that we have. The other thing that's new as of 2021 was we did increase and add a new cardiac monitor, and I won't go into all the details, but I will tell you that they're fantastic. They really do allow us to do some really specialized care. Again, something that you're just not going to find in a smaller community. So we've done a really great job of increasing our medical abilities as well, to really just have an amazing community. And then the last thing on there is that with our last ambulance purchase, we also now all 4 of our ambulances have a hydraulic load system in it. And I know I got the chance to show Francie how that works. But it essentially saves our employees. One of the biggest things with paramedics over the years is that they don't last very long because it's a tough job. You're lifting constantly, you're bending constantly, you're reaching into cars and pulling people out, and it's really difficult. So anything that we can do to make it safer and easier for them, we're going to try and do. Having hydraulic load systems which allow us to load a patient into the ambulance in a very efficient way with a hydraulic system rather than muscles, really helps out with the safety. So we've done a lot with operations in the last couple of years, really making it a better service for the community, better for our employees, and really having just a medical level which is unprecedented in most smaller communities. Just talking about the staff again, there's our increase in staff that we talked about and the monitors. We're also noticing, as I said, with our increase in folks here in town, really happy to have them, but it seems anecdotally like it's a different crowd, right? There are people that aren't as experienced maybe in the side country or back country settings. There are people that aren't as experienced with bikes. I think we see that a lot now. There's so many more people on e-bikes, which is a great opportunity to get people out there, but it also brings on more injuries. So we are starting to push more into some high angle rescue, which is ropes and having to get people off of steep cliffs, things like that. Swiftwater rescue. I think that most of you have seen some of the absolutely horrible incidents we've had this year with Swiftwater. And then side country rescue, even something as simple as somebody who turns their ankle on the Hunter Creek Trail or the Ute Trail, we're there and we have to be able to grab them. So some of those and most of those areas in kind of our expanding work area now require some additional equipment, require upkeep of that equipment, and so on and so forth. Fuel, need I say more? I think we can all drive up and down the valley and see the fuel costs. And then just our vehicles, as I called out earlier, you know, in 2014, our last ambulance was 150,000. The last one we bought in 2022 was 244,000. That number continues to go up. And we actually had an ambulance slated for purchase in 2022 that we put off because the cost of it would have exceeded our available funds. So we did move that forward. Just as an idea of replacement cost of ambulances, we have 4 ambulances in our fleet. We try and replace each of those ambulances at 8 years of use. That's when we find that the maintenance costs start to rise, that the reliability starts to go down. We work them hard. You know how the roads are around here. We take them off-road at times. So it's a hard life for our ambulances. But what that means is every other year, we will purchase 1 ambulance. So it's a nice way for us to look at it, and moving forward, it's a great way for us to budget as well, knowing that every other year we're going to have a fairly large sum to replace that ambulance. And unfortunately, as much as I would love to get the same amount out of a used ambulance when we sell it, we certainly don't get that amount out of it. I believe the fleet suggestion is a 7% return on that cost. So. If I said that right. So you know, we are not getting a used deal, that's for sure. So those costs just continue to go up. So where are we now? Certainly education and training, if we want to continue this high level of care, if we want to continue to be on the cutting edge of medical treatment and do what's absolutely level best for our community in any area of it, we need to continue with education and training. I will tell you that to be a paramedic, your normal average paramedic does about 70 hours of extra training just in medicine alone each year. So that's 70 hours of additional time that they are giving to education. Now, that doesn't include ropes training. That doesn't include swiftwater training. That doesn't include wildland fire training. So they have a massive, massive requirement for that training. Now, to go one step further, as I've said, we only want the best here. So we've pushed our medical needs, or our medical services, to a critical care level. And that is above and beyond what a paramedic does, which is additional hours. So we have a large requirement for that education. Safety gear, I have listed there. Turnout gear, we're required to have safety gear when we enter a car that's been crashed. There's lots of metal and glass. We want to be safe in that regard. Those turnout gear also allows us to be here if we ever had a wildland fire, which, as you know, is probably one of our biggest threats in this community. We can still be in that area. And then certainly, as we found out in the last couple of years, we have to have very specialized gear for infectious disease. I think that's one of the things that we talked about last time, is that infectious disease was something that we always knew was out there. We had great equipment, but boy, did COVID show us what it really meant to have protective equipment for infectious disease. So now we're in powered air respirators. Now we have Tyvek suits. Now we have quite a bit of extra equipment just for infectious disease. I would love to say that we'll never use it again and that COVID is over. By gosh, would I love to say that, but unfortunately I don't think that's going to happen. So we need to continue to be prepared for that. Keep in mind, this is very different equipment than you're going to find in a hospital. In a hospital, we're in a nice controlled environment. I still have to deal with infectious disease in a broken, crashed car. So anything that is impermeable to something in a hospital certainly isn't going to be that way if I'm brushing up against brush on a side country trip or in a crashed car. So it's very specialized equipment. Again, some of that specialty equipment for the different types of rescue that we do, the medical equipment we talked about, having very specific medical and monitoring devices. Communication equipment, which I believe you'll also be tackling this year a little bit of, is having a robust dispatch system. We need to have the radios and abilities to communicate in that. And then quite honestly, the last one is probably the most important, and that is really just that we have, over the years, as much as we have tried to work within our budget, we've put off replacements. We've put off new equipment. We've put off some equipment that we really should have for a current model. And of course, any of this equipment that we get, it has a hard life. It really does. Being outside of a room, being out in outdoors, it has a hard life. So we do have to replace equipment fairly often and make sure that it's up to par, so that if we do have to use it on you, that it's in the best possible condition. Thanks. So our volumes, I mentioned that 2021 was just a banner year for us, 25% over 2020. 2022, thus far, year to date, we are 10% above 2021. So we continue to see these volumes go up. We continue to see our community get busier. I think we're seeing that in many numbers around the community. But for us, again, I think we're seeing a little bit different folks in town, and we're going out more often for sure. I do want to call out a couple of numbers there, and you'll see that a 27% non-revenue producing refusal volume. And what that is if we were to go out and one of you had fallen and turned your ankle, and we go out and have a conversation with you, we evaluate your ankle, we say, you know what, it's injured, but you probably don't need an ambulance, and this is something that might be good for you to go to your personal physician. It might be good for you to go to a clinic versus an ER. We're doing a triage, if you will, of your injuries, and then giving you the best possible options for you. Then it's a great service, right? A phenomenal service for our community. Unfortunately, when we do that, we still have to take our crews and our ambulance and go out and visit you. It takes time. Usually those types of calls maybe take a little bit longer, as we have to have a conversation and evaluate a few things. But all of that time, all of that effort, and there's not a reimbursable task there. So in other words, there's no money involved in that, which is good for our community. We want them to have the best options possible, and I'm a firm believer that is the type of non-revenue producing job that we should be doing. But it is a considerable amount. The other thing that we have is about a 13% rate of non-revenue producing standbys, cancel, wellness checks, things like that. So that is if there is a structure fire in town, if something is on fire, we will go stand by at that fire for both the safety of our citizens and the safety of our firefighters, safety of other medical, public safety personnel. We do wellness checks at times on individuals just to make sure they're okay. And then certainly we get a lot of calls where we get halfway there, still have all the same response, get halfway there, and then are canceled because we aren't needed. So in other words, a car accident where it turns out it's just a fender bender and not no real injuries, but we still have to be there and be ready to go. I will also call out that we do on average about 130 interfacility transfers a year over the past 5 years or so. That average has stayed about the same. That is not included in our normal volume. That is volume that we break out separately, as that is an Aspen Valley Hospital department. We do that as a benefit to them and a benefit to our community to be able to provide that. Now, the really nice thing about that is if you are injured in our community, you're a community member, AVH is a phenomenal hospital with amazing experts. But there are a few certain things where you need a specialist to go somewhere else. In that case, we're there for you, and we can pick you up at AVH and take you to another hospital that has a specialist. That's a really important thing to have in a community like ours, because if we didn't have that service, you would have to wait hours upon hours upon hours for another ambulance service to come and pick you up and take you to another hospital. I'm sure, I see Dave Rustler's on here, but I'm sure he can attest to other hospitals really having difficulty where patients just languish in the ERs and their facility because they just can't get them to the specialty care they need. We have that ability. Amazing thing for our community. The building, I think everybody now has gotten a chance to visit it. And some really cool people, Aloysius.
Aloysius got to go see the ambulances.
Well, thanks to your Auntie Patty.
Yeah.
He was amazing. But the building is fantastic. We really hit it out of the park with that. The building is everything we need, and it expands into the future. We specifically built the building so that it would expand with any needs that we had in the future. We've expanded into a few areas already that we didn't think we'd hit just yet, but it is serving the need and doing a great job of it. So we really appreciate that. Again, that was the main reason for our last mill levy ask in 2014, was just a new building. So really excited that we have that, and it's an amazing facility. So thank you, and thanks to the community as well. So the funding sources that we currently have First and foremost is patient charges. So when we go out and transport a patient, and this is only if we transport a patient. So if we go out, we actually put them in the back of the ambulance and take them to a hospital. Whoops, you went past it on me.
Oh, I went right to patient charges.
You did. There you go. So those charges are only if we transport the patient. The idea of patient charges is really interesting, and I'm certainly going to have Dave Ressler pop in here and make some comments as well. But when we set those charges, we look at those charges yearly. They are based on a local, regional, and national surveys to determine where our charging is. We are right where we need to be in that regard. If you look at the survey amounts for those current charges, we are in the upper third already. So in other words, we're about as far as we can go, realistically. Now, Dave, if you don't mind, I'm going to let you pop in on the reimbursement of charges because this is quite an interesting discussion and one that I want to make sure that you understand well. So Dave, if you want to take over there.
Sure. Thanks, Gabe, and I apologize to all of you for not being there in person. I had a meeting that ended right after 1, and I didn't want to get caught in the car for this conversation, so I just jumped on by Zoom. But to Gabe's point, and actually I'll illustrate the point a little further, hospitals don't really have the ability to control how much of what we charge we actually collect, and that's such a foreign concept to any business owner or anybody that's ever been involved in trying to predict what amount of revenue an organization is ultimately going to achieve. And a large part of that is simply because of the percentage of patients that Gabe's team cares for that are insured by government payers, such as Medicare for the elderly and Medicaid for the financially vulnerable. And they set their own reimbursement rates, and they're frustratingly volatile and based on a number of factors that often we don't even really understand. And then insurers as well will deny claims, find all sorts of reasons to reduce the amount of reimbursement. And particularly, this is the case when we have patients that are from out of the area where we don't have contracts as a hospital with the insurers for these patients. So then we really are at the mercy of the insurer, and they treat it as out of area, and I'm sure we're out of network. I'm sure many of you have experienced that as in your own lives as insurers. So to punctuate Gabe's point in this third bullet, where he references that our average reimbursement is 63.9%, it's down from 71% in 2014. Already in 2021, that's ticked down to 59%. And so in financial pro forma that our Chief Financial Officer, Jeanette Siebenauer, has been working on with Connie and Gabe, she continues the trajectory out over the years. As another indicator is our percentage of Medicare and Medicaid patients continues to tick up as well. And as I said, that adds to the volatility of the reimbursement, or said better, the lack of reimbursement. And we're seeing that as a hospital. That's partly an aging community, that's a graying America, that our percentage of Medicare and Medicaid over the years continues to climb. So as a result of all of these factors, we have to assume that over the next few years, we're probably going to be approaching 50% of collections based on our charges. So that's just a fact of life. It's something we deal with. I do have the pro forma that Jeanette developed. If you have any additional questions, and actually I can pull her into the conversation if that would be helpful. But hopefully that gives you kind of a roundhouse view of the dynamics that we're dealing with.
Thanks,
Okay, does
Dave.
the board have any questions at this point, Steve?
Yeah, Gabe, I was just doing some research because my fishing license pays into the search and rescue fund. So when you go out on a whitewater rescue or a backcountry kind of a thing where you have to take an ambulance there, it looks like you should be reimbursed by, at least if you transport somebody, are you reimbursed if you don't transport somebody in that instance? And do you get reimbursed if they don't have the right license from the state of Colorado?
That's a great question. First, I don't know why anybody wouldn't have a fishing license, right? So,
Carry mine with my COVID card.
there
by
you
the
go, right? No, that's a great question. And with the Corsair cards, they're really meant for backcountry rescues. And so those fees typically go more to the mountain rescue organizations, which our local MRA, fantastic organization, does get funding from that. Most of ours are more of what's considered a side country or even front country type rescues, right? So the Roaring Fork, as an example, as a river will run right through populated areas. So the Corsair card, backcountry type card, doesn't specifically work for that. So no is the short answer, is we do not receive funding from that unless we are involved in it in the aspect of transporting somebody. So if we transport them from a backcountry location to the hospital, if we transport them from a trailhead or a helicopter or something like that to the hospital, then we'll charge a transport fee for that. But the actual act of going into those locations, no, we do not get reimbursement for that.
Okay, and do you have to ask the person, do you have a Corsair card? Or
If
does the
they are in the
hospital do that
backcountry,
when
yes.
they arrive there, or how does that work?
No, funny enough, that's usually done by the agency that grabs them from the backcountry. So, for example, Mountain Rescue would ask them that if they have that card available to them. So it's a hunting or fishing license, or you can buy the Corsair card specifically. So, but yes, they would ask them that at that time.
Okay.
On a side note to that, it's my understanding that Colorado Parks and Wildlife, now when you use their put-ins or takeouts on the water, you need to have a fishing license because some of those funds go towards the maintenance and the building of new put-ins and takeouts along the river. So another thing people need to know.
Yes, absolutely.
Yeah, on this topic, is the scope of what the ambulance district does with the type of rescues you're talking about, is it based on location? Like, is it where jurisdictions kind of butt up? Is that how we should think about?
No, I really don't. The easiest way to think of it is a system, right? We all play a certain part. So we have a part, the sheriff's office has a part, the fire department has a part, and each of us kind of plays a position or a role within those rescues. So jurisdictionally, we certainly have a district that we operate within, but in the event of a large incident, for example, we may cross those district lines to work with each other on something larger. If it is a swift water rescue, for example, one of ours that we've had to deal with this year is the Punch Bowl, right? That I think we had 5 or 6 different agencies all working together on that. So you really have to think of it as a system with each of us playing a specific role, and some of those roles even crossing.
So are you doing new work that Mountain Rescue used to do or somebody else used to do? Is that, I guess I'm trying to think about if you're trying to improve your capacities here,
Right.
is that taking some pressure off of capacities in other agencies?
That's a great question, and I would not say that we're taking too much pressure off. What we're taking off is the medical piece, right? Before, the medical piece at times may be lacking. They didn't have a paramedic available on a swiftwater rescue, or they didn't have a paramedic available for a high angle rescue. Us, as Aspen Ambulance District, we really have the bulk of the paramedics in there. We do have the paramedics in the Upper Valley, and so to provide that level of care, we want to provide that wherever that patient may need it. So for us to participate in that, for us to get access to that person, then we have to do that same level of training for high angle, for swiftwater, things like that. To operate near a fast flowing river, we want to make sure that our crews have all the correct PPE and the correct training to be in that water environment. for sure. So that's really the better way to look at it, is just really system improvement. And paramedics are quite the commodity, right? I mean, we have the ability now in the field to do amazing treatments that truly are life-saving. And to put them as close as we can to the point of injury, as close as we can to the point of extraction, really is life-changing. And from a trauma point of view, the quicker we can provide that care and in that environment, better chance we have of saving a life.
Thank you.
You bet.
I think one of the key things for me is, of course, the decrease in reimbursement and the cost of doing business as far as supplies, fuel, et cetera. But I think one of the things for our community is the fact that we found the need, and we filled the need of having 2 ambulances and 2 crews on at all times. And that was because of demand, because of transfers. When we have an ambulance that's transferring patient to Denver, they're gone for 8 hours or more, likely more than that. And we still need to be able to provide the service here. And it's great that we have or mutual aid agreements with our, our neighboring ambulance districts, but they're also busy at times. And when we have special events, you have to have, in most cases, you have to have an ambulance on site. If that ambulance has to transport somebody off-site, you have to have another ambulance come onto the site. I know at rugby games, sometimes you have to hold the game until another ambulance gets there, because the next play out there could have another person who is in need of care. So I think that's something the community really needs to understand. The other thing for me, for the community to understand, is we have increased our level of care to such a degree because the community has asked us in many cases, in all cases probably, for that increased level of care because of some of our demographics in our population needing more, response, because of our backcountry users who, in many cases, are also growing in need of response. And so it's not because we wanted to do this, it's because we felt a responsibility to our community to do this, to increase the level of care, the level of service. And so, therefore, I think getting the community rallied again to support our ambulance district is important in order for us to continue to provide that care that we believe the community wants and that we would like the community to see in the future. So I think those are key things. And you never know when you are the one that's going to need that ambulance, and you want that ambulance, and you want a trained crew to be there for you, for your loved one, for a friend, for a neighbor, for a visitor, for a guest. So I think that's important.
Yeah, thank you.
So are there any other comments from the board, or we'd like to get to some numbers?
Let's get to numbers.
Oh, Greg has a hand raised.
Who? Oh, Greg, sorry, I don't.
Hey, Patty. You
Michaela,
don't see
I
me,
don't
I know.
see that.
Thank
But no,
you.
I have to keep it here and then it blocks my screen. Michaela, I don't have the,
I just want to, Gabe, thanks for coming in. Sorry I'm not there. I'm
can't see
actually
Greg.
down with COVID.
Oh, no.
So I'm hanging in there, but I'm not really able to participate beyond like I am right now. The question was, first of all, you reduced the inventory of ambulances by 2. How large is the Valley, cooperating agencies inventory of ambulances? It seems like you made the right call on that, certainly. But can we assure people that we have more than just 4 ambulances serving the Upper Valley? That'd be my first question. I guess I'll just stop with that. I've got another one though.
Yeah, that's great. Sorry to hear you're under the weather. Hopefully that resolves quickly.
I dodged it for 2 years.
That's pretty good dodging for 2 years. In answer to your question, and funny enough, almost right back to Kelly's question, is this is a system, and that's one of the things that we operate on really, really well with our other public safety agencies in the Valley. So in the Upper Valley, in the Aspen area and Pitkin County and the Upper Valley in our district, we do have those 4 ambulances available. There are also a couple of ambulances available up in Snowmass with Roaring Fork Fire, and don't quote me on this, Scott Thompson's going to kill me. I believe that they have 3 or 4 more down in the Basalt area as well. Now, the way those work is while we have our own districts and we have them in certain areas of high use, If one area gets a lot of high use all of a sudden, the other ambulances kind of flow into that area. So think of it just like a pool of water. It just kind of flows throughout the day. And there are some days that we may be down valley further. There are some days that Roaring Fork may be up further. But in the end, we have quite a few ambulances to deal with any large scale or hopefully not a huge scale, but a large scale incident, and have enough ambulances available for our community. So it's a great program. It's done pretty much throughout the United States. It's a term we call mutual aid, which means that we will mutually assist our partners as much as they need, and they will mutually aid us as well. So great thing. In the end, I will tell you that we're about even with Roaring Fork Fire and ourselves. We kind of flow back and forth. If you were to truly do the accounting of how back and forth we did, it's pretty darn close. Certainly, we used it a little bit more prior to having the 2 ambulances on 24/7. Now we are using it a little less, but I will tell you, it seems as if their volumes are going through the roof as well. I think we're all in the valley, as we all know, experiencing just huge growth.
Because we pull in from Carbondale Fire and from Glenwood Springs at times too, or move them around if Roaring Fork comes up here and then they cover down there, and so it is, yeah. And it's not, the water doesn't always flow downhill, sometimes it flows uphill, so.
Showing my age, I guess, with the slinky thing, but yeah, just up and down the valley, kind of moving back and forth.
Slinkies are
Absolutely.
back in, by the way.
They're time immemorial toys, I can tell you.
Now they're plastic ones in high and bright color. Francie had her.
Yeah, so if you go to something in the Basalt area in their district, do they then bill for that and collect that, or does it come back to you, or do you just let it reside where it landed?
Great question. No, so it's all based on the transport. So if I were to go down to Basalt and pick up a patient in Basalt, I would bill for that service. If Roaring Fork had to come up here on a busy time and they picked up a patient within our district, they would bill for that service. So it's actually the service that's billed for, not the district, if you will, that you're in. Mm-hmm. So we do get the revenue off that, in that regard, but it's even, I guess, is what I'm getting at with how much we use.
And didn't we have a little glitch in the past with collections when they, say, went to Valley View and the billing? We worked out.
Yeah, I wouldn't say it was a glitch. It was just a billing piece. All of our billing that Aspen Ambulance District does, we do with in coordination with the hospital. And the way that we did that was based on a hospital patient number. We would create a number for them within the hospital billing system. If we went directly to Valley View for, let's say, a cardiac specialty that they have down there, we would just have to outside bill it. We wouldn't have a specific patient number. So it was a non-issue. It was just
something we just figured out.
Yep, figured it out.
Kelly?
Yeah, I wondered if you could go back to, there's 2 things I want to revisit, was the source of all the revenues, which maybe we'll get into a little bit further, and then when you had listed the kind of non-reimbursable calls that you guys make, I just want to understand that a little bit. Phyllis, is it possible to go back to that slide? It's one of the very earlier slides.
Michaela, how do I go backwards?
Hit the arrow that goes the
reverse
other
button.
way.
See, these are your back and forth.
See, keep going.
Too far.
Too far. It said like 17% something.
Yeah.
There you go.
Right
There
here.
you go.
Okay.
Yep.
So I guess I'd like to understand this a little bit better.
Sure.
Because the way I'm thinking about it is I'm like, okay, you have a budget, you have all the stuff you have, and things just either have to fit in there or don't, or they don't. Because this is always working on a, what's the word, like a debited system, right? Like you have to budget for it and then hope you get some of the money back to fill the next year's budget, right?
Understood.
So we're always budgeting in arrears, is what I understand. So when you're dealing with these type of volumes, is are the revenue producing volumes increasing over time, and how do the increases in non-revenue producing volumes affect those?
Understood. Great question. So,
Thank you, because I was not articulate.
you articulated it well. Let's see if I can return the
Okay.
favor. So number one, all of our volumes are going up, right? So we continually see just in everything. The only one that seems to really be standard for us is our interfacility transfers. That just seems to be a number that's
interesting.
pretty solid. I think that's just our high acuity patients that need specialists. It just has stayed the same. If you look at our total volume, the amount of transports that we're doing, where we actually pick somebody up, put them in the back of the ambulance, and take them to a hospital providing medical care on the way, that volume is rising as well. So overall, those volumes continue to increase. Now, as a whole, for all of our volumes, every time that we get a dispatch to go out on a call, they're all rising at about the same rate. But what we are seeing is that 27% rate of refusals is staying about 27% of that total volume every year. So, which is roughly the national average. In larger cities, you'll see it up into the 40% range. Most are around 30%, give or take, and I think that's pretty standard for our valley as well. But that 27% is while the number continues to rise, the percentage is about the same of our total volume. Same way with our standbys, cancels, the other, the 13% there. While the volume number, that number continues to rise, it still maintains about the same percentage rate of what we're doing every day. Does that answer it? I know
It does, but I guess what I'm wondering is, so if the number of reimbursables is getting higher as well, why isn't that covering for what is the same fixed cost?
Great. So as that number continues to rise, right, and we have a larger volume of reimbursable revenue-producing runs, as that number continues to rise, we would hope that our patient revenue would increase with that, right? What we're finding, though, and to Dave's point, what we're finding is the amount that's being reimbursed continues to drop, right? So we're seeing an increase in volume, but a decreased reimbursement. So while we're able to, mitigate that number to some effect, the reimbursement continues to drop at seemingly a higher rate than our increase in volume.
Okay, thank you.
And
That's
with your
really
increase in volume, we also have the new increase in costs.
Absolutely, absolutely.
So that's throwing that balance off even more.
It is definitely a balance.
And Francie, before I call on you, just real quick, so when you have a call, somebody's coming out of the backcountry and they're coming into the center at Maroon Bell, you respond, you're there, and then a helicopter comes in and transports the patient. What is our role there? I mean, you've been there, you've been giving care, you've been using supplies to stabilize the patient till the heli comes in and can take them to wherever they need to go. Is it still a reimbursable call for you if you didn't put them in the back of the bus and bring them into town?
You got it. Great question. And you've hit on one of the things that comes with all of the reimbursement for what we do every day. If we don't transport them, if we don't physically put them in the ambulance and physically provide care and transport or move them, then there's no revenue for it. So we can provide care. We can do that.
That could happen for most cases if you had a call to the base of Maroon Bells.
It happens.
And you were on site till the helicopter came in.
You got it. You got it.
There's a coding for house visits.
Put them in the back of the ambulance, drive them a quarter of a mile down, have the heli pick them up.
Right, exactly. Yeah, I wish we could do that. We'll drive them around the block
Yeah.
and back.
Yeah.
But I got to tell you though, I realize it's difficult. And I'm sorry to cut you off. I realize that's a difficult thing to understand. But I have to tell you, from a paramedic standpoint, from a heartfelt standpoint, a community member standpoint, I love the fact that we can give just top quality care to people. And quite honestly, I don't want my paramedics to worry 1 second about the cost to that community member, right? If we can save their lives, if we can play a part in saving their lives, then what's that worth, right? as an administrator, it's awful, right? To not be paid for doing all this work by, gosh, we gotta pay the bills. But in the end, that's really what we're looking for, is to be able to provide that amazing service. to
That's
our
what
community.
healthcare is supposed to be about.
Preaching to the choir.
I'm the old school, I can tell you that, right
Right.
there. I'm old school on that one. Fancy.
And that's why taxpayers should support you.
Thank you.
I did want to say that I was up at Flaming Gorge at one of the campgrounds there, and we couldn't get into where we were going because there were police cars and an ambulance helicopter there. And they were there for about 2 hours with this man who possibly had a heart. I don't know what's the matter with him.
Oh, wow.
I don't know. And so he refused transport. So I'm just thinking all of that time and effort was never, he incurred no costs, right? That's pretty amazing.
Nothing. Nothing.
Yeah, so,
Yeah.
I mean, I think given that, and given the rate of reimbursement going down, it is obviously a public service to the community, and so obviously the community has to help support it. I mean, it's pretty
Agreed.
obvious.
Agreed.
With
And I
that,
keep seeing Greg on there. I don't, I'm
Greg?
gonna be the guy that points Greg
Greg, are
out.
you still waving your hand at me?
Still, yeah, that's me. My hand's up. I had a couple questions, Gabe. One was, is there any way we could consider doing something like a Corsair card that would work for the local ambulance? Like, is there any way that we could do some other mechanism for raising revenue for the ambulance district? Just a thought throwing out in my delirium here, just wondering if there might be a locals ambulance card. It's like the Corsa card, but specifically for the services that Corsa doesn't cover.
I don't think that's a delusional question at all. I think it's a great question. There are certain places that have tried what's considered a subscription, right?
I've
So you
seen
have a
those.
subscription to the service where there's a certain different billing model or whatnot. But I can tell you the amount of reimbursement is still the same. It's very difficult to collect that. And then what do you do if it's a local that doesn't have their subscription and the next person does? Now there's a kind of an inequity there. They're a ridiculously difficult program to run, and there's not much benefit from them. Most places will try it for a short period and then immediately get rid of it because it takes so many people and so much effort to run.
Okay, thanks. You've convinced me. Could I ask my second question, Patty?
Please,
Yeah, go ahead.
This is an aside, but as you'd expect from me, in May of this year, they started releasing the first electric ambulances in major cities. Their maintenance cost is about 80% less than your typical ambulance. Fuel costs are much lower. They're only at 140 miles of range, which could be problematic in the winter here. But I'm just thinking, in the next cycle or two, when you're buying ambulances, you might take a look to see what electric options are available.
Yeah.
So thank you, and I'm already one step ahead of you. The ambulances we've looked into, and you hit on the main reason why at this point I don't think it's appropriate for us, which is just their range. Even locally, we would have to have the ability to make quick moves to go down to different locations. It obviously would not make it all the way to Denver, so we couldn't, or Junction for that matter. So it'd be really difficult for us to do any of those transports. But I will tell you that one of the things that we are looking at as a potential is our command vehicles. Those are a little bit shorter distance modules, and those might be an option in the future. But I do think that, the one thing that still has me concerned is just the reliability and making sure that we always have that service available, and I don't have to worry about, the range if it's a really, really busy day. But one step ahead of you, we are keeping a hawk eye on it, and the moment that we feel like it's right for us in the community, I think we will absolutely jump on.
Well, I, for one, would
Great.
hate to be
Thanks.
in the back of the bus when the lights went out.
Agreed, right? Turn a few
Or you
extra
can't
light
go any
switches
further
off.
down the road.
Yeah. Good point, though,
But
Greg.
thank you, Greg. Yeah, absolutely. We're keeping an eye on it.
Well, I popped the tax slide up again.
Yes, we need
As
to.
a special district, the Aspen Ambulance District isn't all of Picken County. It's from Gerbaz-ish, all the way to the top of Independence Pass, all the way to Hagerman on the other side. So it's quite big.
665.5 square miles.
I
as
didn't-
GIS tells
Didn't
me.
know that. So just history of the mill levy, it was set in 82, it was 0.82. Our guess is all that they set it at 82 because it was 1982. Tabor decreased that mill levy to 0.22 at the point we were doing the last ballot question in 2014. And then we went to 0.501, which was de-Bruced at that time.
And that was because everybody was wearing 501 jeans at that time?
Okay.
Getting something.
See, now she taught me how to go forward and back, and I'm cruising. So that's our one stable piece that balances this. And as the ambulance district within the hospital balances what their revenues are and expenses, it's that tax that balances the books each year, and Connie can explain that. There is another charge that's thrown in here, is special events, which they do a lot of, and I'll let you explain that one too, Gabe.
Sure. So special events needs no explanation. Most of what we do are the larger events. So if you want to think about some of the bike races, X Games, World Cup is coming. Yay. So we're really excited about that. But those larger events certainly need a specific medical component to them to make sure that those that are there or participating in the event are safe. And we want them to have the same high level of care as anybody else does in the community. So we continue to do those. We do have a rate system per hour for a couple of different levels, a single resource. So if you just need one person there to watch over small events, low risk, an example of that would be the Ideas Festival. We put somebody there that's available. They run around with all the equipment set to go. There's one charge for that, and then another charge for if you use the entire ambulance with 2 crew members ready to go. We contract that with the providers of the events. And then the rate system that we have for that allows us a little bit of profit, which allows us to replace equipment and use. That being said, if we do transport from one of those locations, then we do charge the individual that we're transporting additionally. So there is a bit of some revenue in there, which is reflected in our budget as well. So. The only difficulty with the special events is we never really know how many events are coming and how big they're going to be, and do we know if X Games is coming back this year? Who knows? It's things
That's all
like
right,
that.
we don't know either, so.
Well, I was hoping you did. I was really excited that maybe you had some information. But yeah, and then something pops up like World Cup. We're suddenly finding that World Cup will be here next year. So super excited about that.
And then we have, some events can bring their own if they're approved and licensed, right, Phyllis? And
They have
need
to
to
be
plan
licensed
ahead
in
to
the
do
county.
that.
Mhm.
So it doesn't happen very often because they
Doesn't.
fail to plan ahead.
So if it's something like X Games, is that like then ESPN that you contract with, or Vesquico, or?
Yep. So in regards to X Games is a great example. We actually will contract with SKICO, right, to provide an ambulance. And what that does is it provides an ambulance on site and dedicated. That being the term, right? Dedicated to the event. So it's not going to get called away unless we have some major incident, a plane crash or a huge fire or something like that. But that dedicates that ambulance and crew to their event. X Games is a great example of an event that uses both types of services. We'll put an ambulance out there, then we'll also have a couple of paramedics that are on the venues themselves to be able to provide that care. And I got to tell you, I'm always very proud to say that with a lot of these large events, they are thoroughly amazed at the level of care they get. I mean, it's hard to find a critical care level service even in a large city. So they're just happy as all get out to be able to have our service available to them. And I think it's great. If we have somebody coming here for a special event and they leave knowing that they had the best care possible, that's pretty amazing.
And I want to reiterate, we don't provide that level of care because it's a luxury. We provide that level of care because that's what we think is the right thing to do.
Absolutely.
For the community, for the visitors, and it means a lot. You'll have a lot of people, surprisingly enough, and Dave can probably attest to this, who like the fact we have a hospital right here, because people come out here and they want to know if they're on the slopes or if they're doing one of their crazy things they do, that they're going to have medical care accessible to them if they need it, and rapidly accessible. So a lot of people do that. They shop for places that have high level of care.
Absolutely.
Kelly?
Yeah, I'm a little concerned that we won't finish in 5 minutes. And I want to walk through
I've
the.
completely lost time.
Thank you. Me too.
We saved a little time
financials.
earlier, so we have a little time to be flexible.
Okay, because I do think I do have questions about
Yeah, go.
No, please.
That's what we're
10-year
here for.
budget in front of us.
Apologize for talking too much.
Oh, no.
No,
all good.
it was all, it's been a good
I'm
conversation.
passionate. I love my job. So. Could talk all day.
So just, I'll roll through these. So the department will lose its reserves in 2022, goes negative in 2023, and so here we are. So looking at board direction and then any other questions, would you support a ballot question to increase the mill levy for the ambulance district? And if yes, we would bring back a potential mill levy recommendation, although there is one here since they were working yesterday and figured out a potential number. And then ballot language for your consideration. Ann Driggers did draft the first shot at ballot language, but that's part of the discussion. If we can discuss it here, we can bring it back to you. But the timing is such that it has to be certified by September 9th.
And it's a two-read,
And it's a two-read, so we have August to be able to put this together.
and we can always put on a special meeting,
And we
like at
can
the
have
end of one of
special
our work
meetings.
sessions.
Yes.
So I am thinking about just going ahead and booking time on the 9th of August, because we have a work session that day. But Kelly, and Ann, thank you for drafting your language, was much better. I had more blanks than XXX and X's, so if we want to go through it, so.
Well, I
Kelly.
changed it. It's very different from the last language. And
Yes,
I
it
can
is.
talk about that later. But
Yeah.
I'm less concerned about the language than I am about having a discussion about the financials, because, this is the important conversation for the community to understand. And, when I look at this, I look at a doubling of the mill levy, and I think we need to articulate that as to why it's not a more, graduated increase.
Yeah, and
so-
we can go into it in more detail in another meeting, but just a short version, I would say that this has been building for a while. We have struggled, I would say, over the last 4, even 5 years, putting together the budget every year. And each year we've had to really work at it to try to present a budget to the commissioners that was balanced. And so with every year, it's become more and more difficult. So it's not a sudden issue. It's been building over time. And we have done things, for example, capital purchases are the responsibility of the county ambulance fund to purchase. Per the IGA, however, we have had the hospital purchase capital and then charge us for the depreciation because we did not have the fund balance to do that. So it's been a number of years that we've been working on how can we stay within this level of funding and still make it work? How can we find more revenues? What can we do to not have to go to another ballot measure? So just and then we'll bring back more numbers.
and didn't the general fund subsidize it?
Yes,
this
we've
last year?
had the general fund starting in 2021, again now in 2022, and planned for 2023. If the a ballot measure wouldn't pass, it needs general fund support.
And it would in the out years if we don't put a ballot question on that's successful.
And to a far greater degree, yes,
And it's-
unless we cut back on staffing levels and
It's
service.
not only, I think, unusual, but maybe bordering on not acceptable for the general fund to be supporting special districts.
Right,
So
yeah.
I think the public needs to know that it's in the best interest of the public for the district to pay its own way, because there's other opportunities for us to possibly spend general fund monies. So, Kayla, go on, you had more? Or, I know Ann wanted to.
Yeah, I guess it just depends on how deeply we want to dive into this 10-year budget right now. But, if you want to check in with Francie and Steve on their
Francie, Steve?
questions.
That was my
Good.
question, was about where does it come from if we don't get the tax, and
Yeah.
you already answered it, so.
So on this budget sheet, it shows, it says
Kelly, where's
additional
the time?
mill levy .599 mils. Is that what the number that you are thinking you need, or does that number come from somewhere else?
I think we will not be looking at a mill levy, but instead at the dollar amount.
Well, I realize on the ballot question, you always ask the dollar amount, but then that gets, depending on the evaluation, that gets converted into how many mills. But is that what that .599 is, just a guesstimate on,
No, I believe that.
or is that from somewhere
No,
else?
the total would be about 1.1.
Which would be the existing
So it would
5.01
be
plus
that-
this
The
increase.
.599
Yeah.
is the additional to reach
That-
the total
That's,
of.
additional,
Yes.
.599.
Yes.
Okay.
Up from 0.502. So you
Yes.
add those two together for the final mill.
Right.
Um,
So Kelly, do you have some more specifics?
Yeah, I
We
do,
have some
yeah,
little more
sure.
time.
I mean, if we have a little time to walk through this. So I'm curious, there's a new revenue that comes into play in 2023 for community education.
So one of the things that we have constantly heard a need for in our community is just healthcare education. So everything from CPR to AED use to stop the bleed to first aid, woofer training, wilderness first responder training. We constantly have our community needing, wanting this type of education. We now have the facility to be able to hold those classes. We have the staffing to be able to do it, but it would be a great thing for our community to be able to provide that and provide it at a regular operation that that they could easily find that. We've had a couple of really amazing incidences this year where people have used CPR that we've taught that have saved a life. So it has just made me even more excited about putting on a program like that. But what we would do is there are costs to putting on a program. For sure, we would work through, for example, the American Heart Association would be one, and there's a certain cost to providing a certification and cards and things like that. So there would be a cost. We would charge that cost, but then keep the cost low so that we had a little bit of revenue to be able to essentially pay for the program, number one, but then also pay for additional training equipment, things like mannequins and whatnot. But I think just overall, that would be a phenomenal program for our community. One of my life goals here as a director is to make sure that every high school kid doesn't leave high school without knowing how to do CPR. To me, that seems like a pretty easy ask, and I'm excited that the school is, we were talking, we're ready to do
I was
it.
a lifeguard and a swim lesson instructor, so I went
So
through
you
all
get
those
it,
classes
yeah.
for a long time.
And
Are you
Kelly,
still current?
There is
I am not still current.
We need to
no.
talk.
There is an additional expense line about 5-6 rows down under the expenses of community education.
Okay.
So while there's a revenue, there's also a new cost.
So, and then just walking down this chart, what is the revenue? So you have a total revenue line and then a revenue deductions. Can you explain that to me, please?
And I
Sure, and I may actually just jump over to Dave again here, but revenue deductions is exactly what Dave was talking about earlier about how much we're actually charging and how much we're getting reimbursed.
So
for that charge.
we put the charge in the revenue line, but what we don't get is the deduction? Okay.
Yes,
That
yes,
makes sense.
It's really a write-off,
Yeah.
it is,
bad debt.
it is.
Yeah, okay.
And some of that is, there's some charity care in there, there's some, additional items in there, but essentially that's what we're not getting paid for the service.
Okay.
As you look through this 10-year plan, essentially the net revenue stays pretty flat. There are some years where it actually decreases a bit or some very small increases. So you're looking at a situation where your costs keep going up, but your revenue is pretty much staying the same.
Well, and I wondered that because the expenses, maybe this is normal across our county departments, but it seems in 10 years to go from 1.8 million to 4.5 is quite an increase. What's the narrative there?
Well, the increase in costs, first and foremost are just our general cost. Everything that we're doing, as you can imagine right now, from fuel to vehicles to everything, all of that just continues to increase at a rate. But then we certainly, we want to add in a few extra things that will enhance the service, which we have, we've worked for. As Connie just said, one of the things that we've done is we've put off replacement of items. We've put off buying something that is, a current medicine now. There's actually a few items that we have not been able to purchase that really should be in our repertoire that we haven't been able to. We've juggled the cost of cardiac monitors and put that on the hospital. We really need to be self-supported and be able to do this as a district on our own without having to do that juggling. The other thing that's added in here is some community programs, and I'm gonna phrase it that way. One of the things that we're adding in here is not only education for our existing staff, but one of the problems that we're finding, and this is EMS, Emergency Medical Services, nationwide right now, we cannot find paramedics. We just can't. They are a dying breed, apparently. So the way that most places are now doing this is they're creating a pipeline to build them on their own, which, believe it or not, I think is a phenomenal thing for our community, because we're now taking, how difficult it is to recruit good people into our community. We're now taking community members and turning them into paramedics. But there's a cost to that, right? And unfortunately, the one problem with us sending people to a paramedic program is that there aren't any nearby. They would have to go to Denver for a year or so. So we want to be able to support great community members, to send them to that education, come back and support the community they love, and stay in the community. There's not necessarily any growth in that in population, because we're keeping the same people, but we're now educating them. We're keeping them in our community, and just increasing their livability here, which is an amazing tool. But that costs money. But we would like to continue to do that, and I think that if we want to sustain a great service, that's really how we're going to have to do it. We're going to have to home grow, if you will, staff. But I'm actually excited about it. I really am excited, because I think we've got some great people here that we would love to nurture and bring further.
Isn't that program already something that's being done in the Valley?
A
Is
paramedic
Glenwood
program?
looking at that, or?
Nope. So right now, the
EMT.
only courses that are offered in the Valley are EMT courses. The closest paramedic program would be in Edwards. It is a shorter program that CMC runs. Has a little bit less of the clinical opportunities as you would get if you went to a
To
larger
Denver.
city. And that would be the one thing about sending a local person with limited experience. We want them to get as much experience in large volume services as we possibly can. So we would probably look more to those Denver level programs.
But we may be able to look in it as a regional program if,
Absolutely.
with CMC, with the extension to the Front Range for the experience.
And this is already as much as I'd like to claim it, this is not a new program for the Valley. Even Roaring Fork Fire has been doing this for a few years now, realizing the same thing we did. The good news is that we've had such low turnover that we haven't had as pressing an issue as other places have, but we're starting to see it, so for sure.
Kelly, do you have more, or Francie's?
She can, no, Francie
Francie,
can
did you
go.
want to tag on to?
Yeah, I just wanted to say that it looks like the biggest increase is with your full-time employees, that you're increasing the number of employees that you expect to have as time goes on. I assume that's corresponds to an increase in projected population. So that seems to be where the most growth is that I see, like 1.3 million compared to 2.8 million in 10 years. And it seems like a big jump for number of employees. And would the number of ambulances be reasonable for that many employees? And would that have to increase as well? And
I think it's a great question, right? And so these were numbers, obviously trying to look out 10 years and to see what this place is going to look like in 10 years is a crystal ball for sure. Understand that whenever we increase our staff, we also have to increase some support of that as well. So educational. So we would have more time for a training officer, somebody dedicated to that. So there's some of that in there. And then, of course, any time that we have, we are a service where if somebody takes a day off, I have to fill that spot, right? So any increases in staff, we have to have I need some flexible positions that can fill in as we go. And then certainly with population increase, there's a certain level and amount of ambulances and personnel we need to have. So this is certainly a projection, and this is a crystal ball look at that, but just looking at the way that we have progressed over the last, 10 years, looking forward the next 10 years, this is an idea of the positions that we think that we would need to stay as a high-level service. So, but it is certainly a big number.
Yeah, it's a big
sure.
money item.
And
Yeah, Kelly's just gonna tag on Steve, and then I'll give you the floor.
thanks. Yeah, just on this question, is that projection, we're not really projected to have a huge growth in population. Is it more of a conversion into an aging population? Like, is there a difference in the type of service that this is reflecting that we should be thinking about?
Absolutely. I think part of it, it's a little bit of both, right? A little bit of growth, but then also our demographic that we're looking at, our population. We do have an aging population here for sure. But I think what we saw in these past couple of years is just the amount of individuals visiting here, and the type of people visiting here. We have one of the healthiest communities in the country, right? But those that are visiting us may be not as healthy, right? And so
Or as
we are seeing
experienced.
that, yes. So I do believe that there's some of that will continue. And as our population ages, certainly there are many different types of medical scenarios that come with aging, and not just the trauma, right? In the in days past, trauma was kind of our bread and butter. Everybody went skiing. Now, instead of the trauma necessarily, we're also sprinkling in a little bit more cardiac problems, a little bit more stroke care, a little bit more chronic conditions type care. So I think those numbers are always going to be climbing a little bit. But yes, to answer your question, I think that we're going to see our business change in the next few
A little
years.
more slip and falls in the winter carrying all those shopping bags.
Well, but, I mean, it's part of what we accept as a tourism economy, right?
Absolutely.
As part of a tourism economy, we also want to ensure our own access to care.
Yeah, I don't want them to be
As
too busy
residents.
finding them.
Yeah.
I want to be here for you.
Yeah. Okay, Steve, and then we're gonna start winding it down, so.
So we've been talking a lot about affordable housing recently, and my thinking is that we need to provide dedicated housing for essential workers. We can't just throw workers into a pool where it's a lottery system and they might or might not get picked. So if you had affordable housing available for your EMTs, would that help you on, I'm sure it would help you on recruitment and retention. And have you thought about that, providing, do you have any projects in mind that you would do if you had the money to do it?
Great question, and I don't think you can live here without housing being on your mind, right? I think I'm going to answer this in a couple of different ways. The first is I don't think that there's ever a problem with us looking at housing solutions locally or in the valley. I hope you're not going to kill me for this. One of the things that we looked at was that housing is such a difficult question, and I've not seen a good answer yet, right? I think we're all in that same boat. So we decided to try and tackle it a different way. The different way that we're tackling it is through a little bit of flexibility. So for example, one of the things that we took on was our staff now works a 48-hour shift. So they come in at 7 in the morning, 48 hours later they leave and go home, and they're off for 5 days. So in other words, with that flexibility and only having to drive up here once, we're reducing their drive time, which is great for work-life balance. We are allowing them to work a 48-hour shift and then go home. We treat them well while they're here. We have a great facility that's comfortable for them to live in for that period. But then they can go home. And the nice thing is that now that we've created that essentially 1 day a week of work, with all the benefits of a full-time job, now they can have that comfort level to move a little bit farther away and make housing a little bit more affordable. I realize, that further away keeps, and affordable keeps getting a little bit further. But it does allow them to have that ability. So I think what we've essentially done, while I still believe that housing is a problem and something we should concentrate on and something we should look for, we've also tried to beat it in other ways and look for ways that our staff can still thrive in this community, be a part of this community, but yet have the freedom to afford housing maybe a little bit further away and it not be such an impact on them and their families. So we've tried to beat it in a couple of different ways. So hopefully that answers your question a little bit. And we're going to continue to be flexible. I think my staff will probably tell you that our goal right now is throw everything out the window and let's look at things with fresh eyes. Let's look at something new. Let's try something new. And if it doesn't work, we'll go back to the old ways. But it doesn't hurt to try. And I think that's what we're looking for as a unique solution to this.
So what's your longest commute of someone coming from their home in
Well, I think
in
right now
Moab
our
or somewhere?
longest is Iron Bridge. I think one of our folks lives there, but that's about as far as they are right now. But we do have a large portion of our staff that is Mid-Valley, Carbondale area. And I think that's a nice thing for them. They enjoy it. Being able to have that freedom.
They've been doing that in big cities for a long time. People who work in downtown LA live at Big Bear Lake.
Yeah, you got it.
Yeah, I love that answer. That was great, especially throwing everything out and looking with fresh eyes.
Just make sure there's
Awesome.
somebody there to catch you.
got
Okay,
it.
so we'll look at some time maybe on the 9th.
We'll look at the 9th. Today we got to tell you the need and explain that to you. So we'll come back on the 9th, the ballot language, and dig into the dollar amounts and
And
what
real
that should
quick
be.
in closing, I'm going to let the board know that I've been talking with the election office to try and set up a committee, an issues committee. And then once I work on that, I'm going to be looking at help from people. When we know from the attorney's office when our cutoff date is to when people that work for the county have to help outside of their county work time. Because this is an effort that we need to take on as a group. I can only do so much, but I'm willing to get the ball rolling and help and see where we go, and I'll be looking at the board to help me out with that. And when we're going door to door, hopefully we'll have some information we can take door to door with us for the November election. So unless I'm seeing anything different from the board, I think we're going to move forward with the ballot question.
Yep.
We just
Sounds
need to
good to
figure out what we want to do and how we want to word it, and we'll bring it back and start moving in the process to get it certified and get it on the ballot.
Will it be on the
Greg
ballot?
here.
Yes,
sorry.
Greg?
Sorry, just wanted to say thank you to everybody. That was an excellent presentation with plenty of detail, and I really appreciate it. Gabe, thank you. And Connie, I'm not sure who else is in the room, but thank you so much.
Thanks, Greg. Get well soon.
Will it just be on the ballot for people in the district? So Crystal Valley, it won't be on their ballot?
No, it's only within the district.
Yeah.
And it won't be listed as a county question, it will be listed as the Aspen
District, yeah.
district question.
Yeah,
But it'll
Bring
go
you a
up the front.
district map that way.
yeah.
You can see it
That would be helpful.
specifically.
All right, thank you.
Thank you all.
I told you you'd do a great
Good to
job.
see you,
I was
Gabe.
counting on you.
Good to see you.
And Ann, thanks for that draft language. Okay, we are moving into, I believe we have our presenters for the COVID update.
We have a resident expert at home to tell us about the COVID update.
And one right here.
Yeah, ask me anything.
All yours. Where are you? I'm over here, actually.
Oh.
I'm shifting.
Just pick a spot about 6 feet from everybody else where there's a mic there.
Okay, please introduce yourselves for the public and the item that you're going to be bringing to the board.
No, absolutely. My name is Carly Senst. I am with Picken County Public Health. I'm the COVID-19 epidemiologist and response manager.
And again, congratulations for taking this position. We appreciate it.
No, thank you, Patty.
And you, sir, we haven't seen you like at this table in a while.
Wow. Yes, Kurt Dahl, Picken County Environmental Health Manager, and here to support Carly. The disease investigation team actually falls under environmental health in our structure. So
Okay. So what's up?
What's up with COVID? I believe we were asked just to kind of come give a brief status update on what COVID is doing within Pickens County, how our response has changed, what tools we still have at our disposal, and how we're kind of moving forward with the response into what we know has been a busy summer, and looking forward to the fall and the winter as well. So currently, the CDC has us at a community risk and transmission level of high. What this functionally means is that we have had an incidence rate above 200, as well as pretty consistent hospital visits for COVID-19. For the last 6 weeks, roughly. So COVID is present within the community. We know that we have pretty widespread cases throughout all sectors, throughout all age groups. And so just kind of wanted to come here and just remind this group, as well as the community, that COVID is still present and that we don't have any mask restrictions, that everyone should be engaging with their day-to-day lives again, but that there's a few areas and a few spaces where caution could still be taken, and a few populations who are at particular risk who could benefit from some extra layers of mitigation, and just being aware that it's still present even though we're moving into this much more normalized space. So right now, again, within that last 6 weeks, we've seen a plateauing of both cases and incidence rates, which have been our kind of standard metric that we've utilized to make management decisions throughout this entire process. So seeing a plateauing at a moderate to high rate. Just as some awareness, the rate is much lower than what we saw back in the winter with the initial Omicron surge that frequently referred to as a tsunami. So we are much lower than that, but we are still higher than where we would ideally be and higher than the baseline. So we're calling it a moderate rate, even though by comparison, it looks like it's close to nil after Omicron. The current variant that we see circulating amongst the community is BA.5. This is an Omicron subvariant. I'm sure everyone has read something about it in the news. Fortunately, we're not seeing any higher severity or transmission rates. However, we are seeing higher immune evasion. So individuals who have been infected with a previous variant or even with Omicron back during that initial wave are still susceptible to infection with this current variant. We are seeing increased rates of reinfections. We are seeing higher prevalence of cases in general, and we are very fortunate that we have a community that's pretty well protected through that immunity, whether it be through infection or, as we all know, our community is really willing to engage with vaccination, and so we have really, really high vaccination rates and booster rates within the county. And even with all of that, we are still seeing these moderate to high rates of infection. So just as a awareness level, BA.5 is here. It is our predominant variant. Looking forward, we can anticipate that we'll probably see an Omicron subvariant next, but nothing's guaranteed. The big kind of shift that's occurred in the last couple weeks, or last couple of months really, has been this shift to an endemic form of COVID within Pickens County, as well as an endemic response. So trying to build COVID into our systems as they stand while still maintaining adequate protections and access to resources and tools to the community members who really benefit from it. So COVID-19 will likely be within Pickens County, not individually, but as a world. It will be within the community going forward. And so how do we sort of engage with it? How do we integrate that into our awareness levels and our processes? Everything I hear a lot from kind of all areas that endemic means that it'll be just like the flu. And I just want to iterate yes and no. Yes, flu is endemic, but it is also endemic with pandemic potential. COVID is likely going to fall within that category as well. And even where we are right now, COVID with this current variant that is less severe, that is equally transmissible, we're seeing lower hospitalization rates. This form of COVID is still roughly 10 times deadlier than the flu. And so that's where that yes and no comes in, is that there is always going to be the potential that COVID-19 can mutate. We see a highly transmissible or highly virulent comes through, and so it is our job to sort of stay alert and stay mindful and kind of be prepared to respond, as this group knows, as dynamic as we have throughout this entire process. So one of these big tenets of sort of this endemic response is this shift to personal responsibility. It is that individuals should be able to assess their own unique risk factors and build in their mitigation strategies that work best for them. And so what that could mean is that individuals who might have immunocompromising conditions may choose to wear a mask in public or in crowded spaces, or may choose to kind of push for socializing responsibly. So reducing those social contacts, potentially socializing outside. We're very fortunate to be where we are, where there's a lot of options for that. And that the mitigation tools that we have at our disposals are not new. It's just helping to remind the community that they are still available, that they are still beneficial at protecting individuals, whether you are at risk or potentially your loved ones that you're coming into contact soon are potentially also at risk. So the big three are masking, socializing responsibly, and staying up to date with your vaccinations. So if you're due for a booster, we know that those boosters are really effective at helping to protect not only from infection, but also from severe illness and hospitalization, which is the big goal. The shift in response, so how we're kind of responding to the COVID pandemic, is also shifting towards this more endemic style, which is going to be, we have our priority populations. This is not exclusive, but it includes individuals who are 65 plus years of age, individuals who have immunocompromising conditions, minors, especially school-aged children, congregate settings, and long-term care facilities. So our response really is now focused on those priority populations. We want to make sure our schools are open in the fall. We want to make sure those individuals who have primary or secondary health concerns are protected and being addressed and having resources offered to them. So our disease investigation is focused on those populations. If you are a healthy 21-year-old who has tested positive for COVID, we are no longer reaching out to you with those resources, even though those resources are available to you. So feel free to reach out to us. We're happy to help you should anyone need help. But that we really are focusing on those most at risk. Same goes for outbreak response. And so outbreak response used to be kind of everywhere that we saw multiple cases coming out that were all linked, we would respond to it. We are now limiting those responses to those priority populations, really focusing those resources that we have at individuals that we've seen suffer the highest consequences of COVID-19. Again, those definitions have changed as well. 5 linked cases with at least 1 PCR test result. So even our understanding of what a outbreak is has kind of shifted to this broader understanding of it. So everything's pushing towards personal responsibility, layer your mitigations as you feel appropriate, and our response has shifted to sort of this more normalized approach to addressing COVID-19. Just as a general awareness for this group, there has been a change in testing landscape as well as the potential metrics that we're going to use for decisions potentially in the future, or the ones that we're getting good data for. So the big change in the testing landscape is the PCR availability. The PCR test sites that we used to have in downtown Aspen, at the Aspen Airport, and Snowmass, due to the state pulling back some of those availability. There's only 21 community testing sites available in Colorado at this time. That doesn't include pharmacies, that doesn't include primary care offices or hospitals. This really is these kind of pop-up testing clinics, so to speak. And so we are very fortunate within Roaring Fork Valley. We have 2. We have one down in Carbondale and one in the Aspen Airport. PCR tests are available for free to anyone who needs one at these sites, and I cannot stress enough, if you are symptomatic, please go seek a test. If you have reason to believe that you have been exposed, please go seek a test. With that reduction in those community testing sites, we're also seeing an increase in at-home testing. It's an incredible tool to have. There's a lot of different ways to access these at-home tests, ranging from pharmacies where you can purchase them, Amazon has them, community distribution sites which will give them away for free, or the federal government does direct ship-to-home programs as well. So lots of availability for those at-home tests. What these tests are really beneficial for is serial testing, so if you are testing fairly regularly, if you are in a high-risk situation, or testing for at day 5 of your isolation for a known COVID-19 case. If individuals are testing testing at home because they have developed symptoms, so an initial diagnosis. These at-home tests are not as specific as or sensitive as a PCR test. So if you are symptomatic and testing negative with your at-home test, please, please, please go schedule that PCR test for free at one of those community testing sites. They are much more sensitive to being able to pick up those early stages in infection. So PCR tests are still the gold standard. Those are also directly reported to Pickens County Public Health. It is how we develop our metrics. It is how we calculate our incidence rates. And so those PCR tests are beneficial from, start for the patient all the way up to management decisions. That being said, with those two scenarios, with the change in the PCR testing availability and the rise in our at-home tests, which are not reported to public health, we're seeing a change in our metrics that we're utilizing. We know that we are missing cases in our incidence rates and in our case counts. We know that individuals are testing positive at home and choosing to do the right thing and isolate and mask and go through that entire process, and so I applaud the community for that. However, what we have seen is since April, we've seen a disconnect between our incidence rates, our positivity, and our wastewater measurements. So wastewater we've been engaging with for almost a year at this point, specifically looking for COVID-19 variants and measuring prevalence within the community. And so going forward, wastewater is a really good tool for us to be able to look at what COVID is doing within the community at a population level. And so historically, from that start date, all three of those metrics have been really closely linked. And again, just in the last few months, we've seen that separation and correlation. And so going forward, being able to utilize wastewater as that early indicator is going to be really, really important. There are a few setbacks to this. There is a bit of a delay. They do not sample all the time. And so we are very much hoping that that program expands and the availability to community members as well as to us grows. So, and that was ultimately all I had. Happy to answer any questions.
I have a question about wastewater, and then I'll turn to the board. The fact we're also on a water conservation stage, whatever the city has, does that have any effect that you're using less water at home, maybe flushing your toilet less, or not, peeing in your backyard to save water? Whatever measures people are taking. Does that have any impact on, how does it, the dilution factor or so maybe because the water concentration is higher, I don't know, is there any play in that?
Do you mind, I'm sorry,
If you want, here, yeah, go ahead. No,
it's just a thought, thinking about their water use and.
No, and I think that's a very interesting question. The way that they calculate it is, I wish we had one of the wastewater folks here. They can give you.
But they just have a way to calculate that.
Yeah,
that's all I need to know.
Yeah.
So they take that into consideration in there, because I just think it's interesting that the water samples would be up here and our positivity rate is not quite up there because of people not reporting that stay at home, or because there's just other factors at play.
Yeah, and I think looking at that wastewater, we hope as it improves, as those programs expand, as the turnaround time quickens, hoping that becomes a better read on what is going on within the community. But yeah, that sampling is taken into effect in the lab and actually through the sampling methods as well.
Kind of makes you not want to drink tap water anymore.
Different systems. Tap water safe.
And it's good to be at the top of the water chain.
Yes. Now Francine, then Kelly, and then Steve. We've got a list here, Greg, so I'll add you.
Okay.
So the website says we've had 51 cases in the last 7 days, but the wastewater is telling you what?
More.
How many more?
So, and it doesn't do a direct case count, right? So the wastewater, the way that it measures is looking at cases per 100,000. So it's a little easier to kind of equate that to our incidence rate. And again, the wastewater takes a snapshot, right? The day that it sampled is the day that we're looking at that number, where incidence rate is this rolling number, day-to-day shifting as we move through time. So I don't want to say that those are directly related, but those are kind of the two closest ones that we can look at. Wastewater, I do not have the immediate one for today. I could try to pull it up real quick if you give me a couple minutes.
So when it says resident incidence rate of 294 per 100,000, that's based on the county cases that have been reported,
Yes.
not wastewater.
Exactly, yeah.
Yeah, because I know a lot of people recently who had COVID, and I'm pretty sure they didn't call it in.
Yep. No, and the wastewater is showing much higher prevalence than what we're seeing come through. And that's why when I say there's that disconnect, we're seeing wastewater at that higher rate.
And I have seen things for the whole country that they think there's been 7 times as many cases as reported. I mean, over the whole span of COVID.
Yeah, and again, that's the same space that we work with the flu as well, right? And in that way, it's very similar, is that not everyone who comes down with the flu goes and gets the official case count, but there are other tools at our disposal that we can kind of utilize as that early alarm system that tell us that bigger picture.
And if you don't mind, I have one more question.
Yeah, because we're need to.
Okay. It has to do with the boosters, because I did hear on the national news, I think it was on NPR, that the recommendation now is if you've had your 2 shots and 1 booster, you should wait until the fall. You don't necessarily need to get another booster right away.
The recommendations vary by population, so those recommendations depend on each individual's personal circumstances. So this is not, I don't want to say.
No, I heard all the things. Children,
exactly.
people over 65.
Exactly. So what they're trying to push for is that reformulation. So both Moderna and Pfizer have started reformulating their vaccines for an Omicron-specific bivalent vaccine, which is a very fancy word, saying that it's going to target the Omicron variants. And so ultimately at this point, if you got a booster now, you wouldn't be eligible when those new vaccines become available.
Oh, I see.
Yeah.
Okay. Great. Thank you.
Because it'd be kind of the boosting the booster.
Exactly. And so if you are at risk and your doctor says get a booster, go get a booster.
Okay, I've got Kelly, and then Steve, and then Greg.
Sure. Do we post data related to the wastewater testing?
Right now, it is not up on our dashboard specifically because of those delays. It's a new program. We're starting. We don't want to put it public until some of those kinks are worked out.
Sure.
But going forward, I believe that that's going to be the push.
Okay, I think that would be super helpful. And then I find the boosters. Oh, sorry, Kirk. Go ahead.
I was just going to say
Yeah.
that it eventually will post that. What we're doing right now with working with the state health department, there's challenges in our data and how we're producing it because we have such a highly transient population.
Sure.
Understanding what that data means, we're still working through that. So I think eventually we'll get there. But our data looks very different than Denver, and we know that because during the 4th of July we have a very high season. During Christmas it's high. How does that impact it based on our case counts are actually reported as residents or people who say that they're residing here versus this just captures everybody, and so we're still trying to sort through what that means.
Right.
So yeah, eventually we'll get there though.
Employments at the airport, occupancy at the hotels.
Traffic counters on Crescent Creek Bridge.
There you go. And then I do find actually the booster schedules to be quite confusing. So I wonder, is there a good resource that you have found to direct people to besides calling their doctors, which is obviously the best thing to do?
There's a couple. We have one that's on our Pickens County website. It's the booster eligibility click through. It kind of takes people through their individual circumstances or situations. That being said, it doesn't catch every nuance with every individual. So what I also recommend is there's a really good graphic on the CDC's vaccination page. It is, so where ours is a click through, they have it put in visualization, and it takes through folks through some of those more nuanced cases. So both are good options if you feel like you fit most of the mold. The Pickens County one will help you out. Otherwise, there's the link to the CDC one as well.
Great, perfect, thank you.
Yeah.
And how's the uptake with the children's vaccines?
We are seeing
going?
it's slower certainly than some of the booster campaigns or the initial rollouts of a lot of the larger vaccination efforts. That being said, we anticipated that. It's going to be a lot of families going to their physicians or their pediatricians, especially for that preschool immunization rounds. And so we're working really closely with those pediatricians. The vaccine bus from the state is in Snowmass, Old Snowmass, and Aspen this week, and they have quite a few appointments. And so as we get closer to school, we're seeing it kind of step up.
And will this fall into the, Colorado's laws related to vaccination of if you want to opt out for school children, do they have to get that letter and go through that?
Not this year.
Training? Okay.
Not this year and not at this time. There is the possibility that as more approvals come out, as they become fully FDA approved, that occurs, but no crystal ball.
Okay, thank you.
Okay, Steve, and then Greg, you're after
So
Steve.
my question was answered.
Oh, perfect. Greg? Greg, who's our
Yeah,
test
just,
case?
I'm on the test case. How long do you have to be symptomatic before you get a PCR test? I wanted to clarify that. That's the first question. Second one was, are you familiar with I've just been reading news lately that they're starting to trace acetaminophen levels in wastewater, which will give them even an earlier measurement of COVID levels.
Really?
Are you familiar with that?
I haven't read that study. I'd love to read it though.
You mean the higher the acetaminophen levels, Tylenol levels in the water means more
Right.
people have COVID?
That shows up. That shows up before the actual COVID does.
It doesn't
but
just mean
then-
more
so
people
that's-
are taking Tylenol?
Well, in a ski town, maybe it would be skewed here, but it'd be worth looking into. But my first question really was I think I would just anecdotally, I was symptomatic for a couple of days, like very symptomatic before I got my PCR test. And it came out negative. And then I waited a couple more days and I did a home test and it was negative. It was only this morning that I actually had a positive test, but I've really been down for about 5 days. So I'm wondering, how effective are these tests anymore for this variant?
No, that's a very good question. And the effectiveness of the tests has not changed over much. And there's always a spread, right? We talk about statistics, we're talking about large populations, right? There's going to be people who fall right in the middle of that bell curve, and then there's always going to be people on the outside. Greg, I'm sorry to hear that you sounds like you were on the outside. That sounds very confusing.
I'm an outlier.
I apologize, and I hope you get to feeling better. But ultimately, so that's the big non-answer is that the tests have not changed. Their effectiveness has not changed. What we are seeing in this virus is that ability to move. These variants are moving much faster, and so individuals are becoming symptomatic faster. The immunity plays a role in this as well. So individuals who have that immune response typically carry a lower viral load, and that also changes how those tests are able to detect the infection. And so it's a very complex mix between test science, virus mutation, and immunology. And so I apologize. The big answer is that it hasn't changed much. The PCR tests are still really, really effective at detecting even asymptomatic cases, but that each individual is going to have their own unique hodgepodge of those three big factors.
Got it. So there's no particular length of time you should wait before going in for that.
Typically, as soon as you believe that you are symptomatic or you believe you are developing symptoms, the PCR test is going to be, the best case scenario.
Thank you.
And Greg, this is Kurt. If you had an article on the acetaminophen document or research you were talking about, if you could share that would be great. I know that there's been
Yeah, I'll send it along.
I know there's been work on non-infectious diseases, so it could very well be they were doing that. Opiates is the one that I had interest in because, looking at a community-wide wastewater stream for opiate levels might be indicative of whether or not you have an issue with opiate abuse in your community. So they were just rolling that out last year.
Interesting. Okay, Phyllis.
Just FYI, we do have a link on our COVID-19 website, on our, data dashboard. If you scroll down, it's a link to the state wastewater. And within that, you can click Aspen and Snowmass and Basalt. You'll see there's only a few test dates in Basalt, and Aspen has a lot more, and you can see how that lines up. So if you scroll down, you'll see link to the state.
Great. Okay, thank you. It's good to see you. You did a great job.
Appreciate it.
Very
Hope
informative.
you're all able to take some time off
Yeah.
this summer.
Jordana usually does this. She is taking time off. We told her she wasn't allowed, but
She didn't listen to you again.
Yeah.
Good for her.
To
We're
you
proud of her.
also.
Yeah, I got to take some. So
All right.
Yeah,
Yeah,
thank you.
guys.
Thank you.
I gotta go to Crystal Cove here one of these days.
I need to go back. No.
All right, so now we're moving on to Paul. Hi.
Hi.
And you need this nice, simple, prepared letter.
It did. Figure out how to plug this in.
I know. Can you help him?
See you later.
Oh, can I, so we're not actually gonna use that computer? I'm sorry, do you need a computer right now?
Yeah.
This is why we need you.
Sorry.
Well, my name is Paul Holsinger. I work for Picken County Open Space and Trails as the Agriculture and Conservation Easement Manager. And we've been working very hard to work towards this goal of getting a center pivot over at Glacier Open Space, which we've talked about in the past. But essentially, we have this opportunity to improve the irrigation over at the property in a way that will increase production on the property. It will also open the door to extending a lot more ecological services and conservation values to other parts of the property, just simply by starting the infrastructure with the agriculture and then extending it to possibly planting wildlife corridors like trees for deer to move through the property safely or feel more comfortable going from the crown to the river. But again, the first step in this is getting this center pivot irrigation placed on Glacier. We were pursuing a grant with NRCS, the Natural Resource Conservation Service, but somebody else scored above us and they ran out of money, which is how it goes. But we found another opportunity with this Colorado River District Community Funding Partnership application. We spoke with their staff for a few months and came up with a plan to ask for not a little but not a lot of money to go towards the project, and they've given us every indication that this is a good project for them to support. One of the requirements of this grant is to get a letter of support from the county in which this project is. Funny that Glacier Open Space is actually in Eagle County, so we're going to be going to Eagle County Board of County Commissioners as well, but we also wanted to come to Picken County Board of County Commissioners to make sure you all are on.
This is our land in Eagle, and we both need to support it.
Of course. And just last Thursday, myself and Drew Walters, the agricultural specialist for Picken County, presented this to the Healthy Rivers and Streams Board to find out how we could possibly partner in the future, but then also just said, well, hey, why don't we get a letter of support from you as well? And they all agreed to support the project as well, so we'll be getting a letter of support from the Healthy Rivers and Streams Fund.
So I think we have the letter in front of us.
Yes.
The board does? So is that what you're going to show us? Because we have it
Well,
right
I was
here.
going to show you what the project looks like. I think before, when we've updated the board, we've had just a very rough draft of what this looks like on the land. Now we've progressed to the point where we have close to a biddable drawing of what this is going to look like on the property. And we're hopefully going to go out to bid for the project in the next month. So we'll be moving forward with getting that on the ground. So I was going to show you, but it's okay if we don't.
Does the board want to see it? Or,
I looked at it, but I'll see it again.
We're getting there. Give me like 5 minutes.
5 minutes, we'll be done and on to our next. So while you're doing that, I'm going to go back to the board and say, in light of looking at this, Paul brought it and we're going to look at it. Is the board supportive of this letter that's before us? Yeah?
I just have a question.
Yes.
I'm curious as to what what's the match? Like, what is the request of the River District for the total cost of this project?
They're not requesting any match. I mean, Picken County is putting in a substantial amount of money. Mm-hmm. And I think after we went through and said, we've budgeted what we've anticipated the entire project to be about $200,000. So we're just trying to recoup as much of that as we can. They didn't even bring up the...
So are you going to ask them for the $200,000?
Well, no. We talked with them, and what they felt was like a most appropriate ask was something closer to $50,000, because then they can just approve it at the staff level.
I see.
And since we didn't want them to start asking for a bunch of more other stuff, we thought that would be good. So we're anticipating asking for $40,000 so that they can say that they participated, and it'll open the door to future projects down the road.
$49.99.
$49.99.99. Sure.
Can we ask them again next year?
Yeah, we can.
Yeah, I would. I mean, that's great. I'm glad. I think their ability to demonstrate the usage of this funds in Pickens County, you know, or for Pickens County projects, I think would be great for them as well as us. And we send a lot of money to this because it's a property tax that pays for this. And so Pickens County's valuations are sending a large chunk of the total to the whole River District budget for it.
Yeah, it's too bad we're not getting a little more from them.
Yeah.
It's true.
I can understand why that not to
Always
go
the
through
next
hassle,
time
though.
around.
And when we contacted their staff, they were excited to hear from us because they haven't done very many projects in Pick. I don't know if they've done any. So they are ready to start.
They are collaborating with us on the wild and scenic stakeholder effort.
Yeah, that's good. Okay, so Paul, if you want to show us, and then just because I'm seeing support, Paul, if you want me to sign this today, if you just have the copy on my desk, I can sign it.
Sure. Yeah, and like
Yeah.
I drafted that just.
Yeah.
So if you have anything you want to add,
Yeah.
please do.
Okay, so let's see the pictures and see what we're doing here.
Trying to get rid of these. Here we go. I'm getting there.
It's in our packet, but it's really hard to look at.
Here we go. So now, this is all the area that has an aerial underneath it is the glacier open space. I'm sorry, this is an engineer's drawing, so it's got a whole bunch of fun lines, but you can just see the center pivot is gonna have an arm that's about 1,000 feet long, and it's gonna sweep across almost the entire main hayfield there. You can see those dry areas there that have not been getting efficiently irrigated, and that's really just because of topography. Now with this center pivot, we're going to hit probably 50 to 40% more of this ground and be able to irrigate it with about half as much water. Like I said, and that's going to open up some more opportunities to make some plantings and improve wildlife values in other areas of the property, like down here closer to Hookspur Road and along the edge of the field leading up to the crown. We also have enough drop coming off of the hill over here that we don't have to pay for electricity to pump water. It's just going to be gravity fed. We're going to use some power to move the arm around, but it's definitely not as much. So that's what it looks like right now.
God, looks like we've seen this parcel just recently.
Yeah. It's a good one.
A few times. Okay, any other questions for Paul? Everybody's okay reading his draft letter? Okay,
Sounds great.
I'll go put that on
thank
the
you.
desk.
Yeah, I'll be up later at the end, well, about 6 o'clock, so it'll be there.
Oh yeah, I'm going to take off before then.
Yeah. I'll leave
Thank
it,
you.
I'll leave it on
Thanks, Paul. Thank
Charlotte's
you.
desk for you. How's that?
Yep.
Great job, Paul.
Thanks, Paul. All right, we have next, I think we have a request for a special event fee waiver. Is that correct?
Yes, Patty, Suzanne Wolf for Community Development. The Crystal Valley Environmental Protection Association is celebrating its 50th anniversary. They've submitted a special event permit application to us. Their event is on August 21st at the Sunfire Ranch up the Crystal, which is a great location for them to celebrate. Our special event permit, their minimum fee is $650. And I don't know how many of you have seen any of these in the past. Patty probably has. Our understanding is always that community development is expected to pay our way and that fees help pay for our services. So we accept fees for all of the work we do. In the past, when we've had a request for essentially a waiver of our fees, we're unable to waive those. We've never treated it that way, but we've allowed people to come to you to make a request. If you, the BOCC, out of your discretionary funds, would be willing to cover their fee. We haven't done one of these in a long time. The last policy I found, I think, was dated 2006. And at that time, I think we'd had sort of several, and the idea was that, well, maybe the board will consider these twice a year and we'll see who asks, and then you could, figure out what you had available and could cover. we haven't had anybody ask in a long time. And Susie Meredith Orrs, who's helping put this together, came to me and said, gosh, that's a lot of money for us. We're having a free event. We're trying to celebrate. Is there anything we can do about that? So I said, well, I can at least go talk to the BOCC and see if we can help. So.
I just want to mention that in the past, what has made these waivers or this request for us to take it out of our discretionary fund is when it's a special event. It's not an annual, every year they do this. And so we've really kind of highlighted issues like 50-year anniversaries or, some special event. We did that with the rugby club one year when they were doing their 50th Rugger Fest. We don't usually help them with funding. So I think it's appropriate in this case, but because it is. It's a commemorative event. So I think it's pretty important.
I'm a member of SEVEPA, so should I stay out of this conversation?
It's up to you. Are you going to gain money from it?
Definitely not. And they have a very small budget.
Yeah.
Very small.
Is the board comfortable with Francie staying at the table?
I'm comfortable with Francie
Sorry,
staying.
you
and
can't
with
leave the room
approving
just
it.
yet.
The disclosure.
Yeah. Does anybody have any issues with us taking $650 out of the BOCC discretionary fund to show our support for this organization and to help them celebrate their
And
anniversary?
this is their 50th anniversary, right?
Isn't
Is
it
that right?
50? Was it? Yeah.
50th, yep.
I think it would be appropriate, and I remember my dad, when he was representing that district, when there were only 3 commissioner districts, the Crystal Valley was in his district, and he would go to the SEVEPA meetings all the time. He really supported their efforts back in the early days. So I think for their 50th anniversary celebration, to me, that's a special occasion, and I would support it for that.
I had no idea they'd been in existence that long. That's pretty cool. Okay, so I think you're seeing direction from the board.
Right.
So Phyllis, can we direct that to happen? Great,
I'll
thanks.
sort that one out.
Thanks, Suzanne.
Thank you.
Congratulations on your promotion.
Thank you.
Yeah, she's like,
How's it
thank you.
feeling?
I have a mask on.
You're seeing a lot of people?
Is the season, right?
She's been busy.
No, it has nothing to do with that, but you can't see what my face is. Okay, I will, yeah,
She and I have
we'll
been-
figure out how to move money around.
Suzanne and I have been talking more than usual these days.
I know.
Okay,
Bye.
so next we have on our agenda, open discussion, but I think we,
No, I have a couple and Rich
Okay.
has one. So
okay,
we
and
have
Ellen
Rich.
must have one. Ellen, you have,
Ellen has one next. I'm gonna get Rich out of here and then he'll
Okay.
go quick and then you're next.
just remember, we do need a little bit of a break before we get here at 4 o'clock for 2 hours.
It's 3:05. We have 9 minutes.
No, we're pretty good.
Yeah,
No,
this is
just
just
letting everybody know.
This is a quick one for the board. Thank you, Rich Engelhardt, Deputy County Manager. I didn't realize you'd taken future agendas already off the platter this morning, so you're
Well,
very
we
efficient.
had a little space there, and we decided to take advantage of the time.
Good for you all. This is kind of give you a heads up. The Airport Advisory Board is looking at doing a retreat on the 26th of August. They would like to invite this board to the first part of that retreat, just to have kind of an open dialogue, conversation. But I also thought I'd ask you if you have any ideas or things that you'd like to focus on. I'd be happy to take those back to the board. It would start at 1 o'clock on the 26th. We'll get it on your calendars. I think we're also going to dedicate some time towards their emissions conversations they've been having lately. The last board meeting, we had a number of individuals show up in the audience. They brought a couple of experts in and added some advice. So we do need to spend a little bit more time with Mead and Hunt to better define what it is we're going to be measuring, how we want to measure it, where we may want to measure it from. So it's taken more than just the 3 hours we set aside for these board meetings to be able to get to the bottom of those. So we're going to set up a little time dedicated towards that. And then they also wanted to just invite the public in for maybe a Q&A. They really want to build trust out into the community, just with a process of the work that they're doing, and just have a little bit of a conversation. So that's kind of the general kind kind of preliminary agenda, but would certainly take any input that you all may have that you would like us to focus
So
on
this
or
is a
take a look at.
Friday afternoon at 1
It's a
o'clock?
Thursday, I believe,
No, it's a-
26th,
The 26th is a
It's
Friday,
a Friday.
is it?
and
then
the
it's-
25th, which is the Thursday, I'm out of town
That's
for
August?
Northwest Cog, yeah.
Oh,
It is
okay.
a Friday.
Okay. Well, I do know that we sent out a poll to the members, all members of that, and we landed on a date they could all make.
And what
So,
time of day do they meet?
It'd be from 1 to 4,
You might have already said that, sorry.
yeah.
Yeah, because if it's the 25th, I have an in-person Northwest Cog meeting, which is probably in Silverthorne.
Do you? Okay. Yeah, I'm sure it's August 26th, yeah.
I'd be available then.
What better way
I'd
to
be
spend
happy
a
to go.
Friday afternoon?
Yeah, yeah.
I'd
Greg's
probably have to leave
available.
a little early, but I would be available.
Yeah, and I think they're just looking maybe for the first, half hour, just to spend a little bit of time with you. You don't have to stay for the entire thing. In fact,
Where is it?
that's yet to be determined. It'll, we either may have it at the airport airport operations center, or someplace here, but there's parking up there. It's a little easier. It's a little tougher to access by the bus for sure, but there is parking there, so.
So we should add this to the agenda and notice it.
Yeah, that's what I wanted to
That
do
way.
on a future agenda, is
Yeah.
put it there.
You're sure it's the 26th, not the 25th? Because I can't come on the 25th. Last Wolf Day. But I do want to be there.
Yeah.
Well, if it's the 25th, I can't be there either, but this is the date that the airport group can be there.
Yeah.
If it's the 25th or 26th, so it's really up to them, not us.
Let's see.
Yeah, I know, I get that.
It is on the 26th from 1 to 4, Friday, yeah.
Okay, so that'll be on our agendas.
Yeah, we'll
Okay.
get that
Okay.
noticed anyway.
And if there's anything particular, let me know, or any advanced questions you may want them to take a look at, that they could answer for you.
Well, we might be there for the 1 to 4, and they may not get a retreat, so careful what you ask for.
True. Okay, thank you.
Hey,
Right.
hey, Rich.
Yes, sir.
Greg here. Rich, will they be publishing a talking points or a list of topics for the retreat? Because I probably do have questions. They haven't occurred to me right now, and they'll come up. But if there's other topics that they're considering bringing forward, I'd love to see that.
Yeah, Greg, I really think the only one topic would be on emissions. So they would have a kind of a meet and greet with you all, emissions conversation, and then kind of like maybe a Q&A with the public, and that's it.
When you say emissions, are we talking air quality testing, or are we
Yes, sir.
talking various airplane okay, just air quality testing?
Yeah, it
Thank you.
focuses around your resolution that you've adopted on the 30% reduction, and they're establishing baselines and deciding what it is they want to measure, and so there's a lot of information out there that they're trying to sort through.
Excellent. Thank you.
Okay.
You are welcome.
That's it.
Is that good?
Thank you, sir.
Thank you. All right.
Now, Ellen,
Thanks, Ellen. This is a BLM request, and Ellen's the keeper
another
of what it
BLM
is.
request?
Well,
Is this a new one compared to all the ones we've received in the last 2 weeks?
this is one that you received, I believe, in the last 2 weeks. So BLM has invited the county to be a cooperating agency in the development of a resource management plan amendment and an environmental impact statement to evaluate their management of big game species habitat as it relates to their practices and standards for oil and gas development and leasing. And so they're anticipating this to be about a 2-year process from scoping, which just started, to a record of decision, hopefully in early 2024. And they are anticipating maybe one meeting a month. This is a statewide initiative. It's not just our local field office. And the meetings will be virtual because it's a statewide initiative, it'll be easier to manage as virtual meetings. They will determine whether they're going to be once a month or not at their first cooperating agency meeting, which is scheduled August 22nd
ish. I don't think that will change. That's the date they threw out when I discussed it with them the other day. So they've given us a memorandum of understanding, which is the tool that will be used to establish the cooperating agency agreement. And in that MOU, they are asking for a principal representative from the county and an alternate representative. And in my conversation, I'm understanding that really, as a practical matter, they want an informed staff person to be at each and every meeting. But they'd also like to have an elected official as either the principal or alternate representative, so that when they get to critical decision points, they have an elected official at the table. And George Newman and I functioned as staff when we were last asked to be a cooperating agency with BLM. It's been a couple of years ago now. And for that series of meetings, both of us attended the meetings, but those were in-person meetings, and it was a smaller venue, a smaller cooperating agency group. So I think that having one person attend each of the meetings is practical in this case, with the exception that there should be an elected official there if and when critical decision points are made. So that's what I know about the process. And I don't know if you have any questions about the timeline, the time frame, the representatives, the process. I'd be glad to answer them.
I have a question. Who is our BLM? Fancy, I thought you were BLM
I
Forest
am.
Service. Okay, the problem is if they set their meetings on Tuesday or Wednesday and they need an elected there, then we lose an elected at our work sessions and at our regular meetings. And for me, if the rest of the board may be fine with that, Francie knows I'm not so fine with that, especially on Wednesdays.
Yeah, I mean, I've missed a lot of meetings with the wolf thing, that's why I haven't said anything.
Yeah, but, yeah, I think if we had known you were gonna miss that many meetings, we might have had a different.
Well, it was supposed to be always on Thursday,
Yeah.
and then they added the Wednesdays.
Yeah.
Well, what I was told was that when they have their first cooperating agency meeting on August 22nd, that the group will establish the frequency of the meetings and probably the day for the meetings. I don't think that's been established yet. So I can certainly weigh in on that. But yeah, beyond that, I can't tell you how that's going to
We don't,
shake
there's
out.
so much we don't know yet.
But they're Zoom meetings, they're not traveling.
They will be virtual meetings, yes.
Kelly?
I just want to be clear, so they are discussing the mapping of big game habitat as related to oil and gas extraction points? What is that?
It's not so much mapping. There's good mapping of where it's mule deer and elk and pronghorn antelope habitat. The mapping is established. Basically, what's happened is that at the state level, the Colorado Oil and Gas Conservation Commission has done some rulemaking changes in the last 2 years, and they have made it clear that as relates to oil and gas permitting and operations, wildlife habitat has to be really a principal consideration. And so BLM has been told that they need to bring their management and leasing policies into alignment with other state and federal agencies when it comes to permitting as it relates to those big game species habitat. And so that is my understanding of the purpose.
So it's kind of like a pre-rulemaking process.
Yeah, that in
For
order
BLM.
to
Yeah, consideration in the pre-roll, yeah.
in order to change their operating procedures, BLM, they need to amend their resource management plan, which is like our comprehensive plan. And then, and that requires an environmental impact statement process. So they're going to be doing both concurrently, establishing alternatives for the resource
management plan amendments, and then alternatives for consideration in an environmental impact statement process. So it's not mapping so much as it is
Sure.
changing their operating procedures.
Yeah, I'm just not sure anyone at this board has really followed those Oil and Gas Commission changes
Right.
in a very in-depth.
Right.
It just
and-
seems like a big, for me, I will not volunteer for it. You know, it's a big commitment for something that I personally do not have, I think, the in-depth knowledge from.
Because for us, it
how
would
we
just
got
involve
here.
Thompson Divide. That's the only place we have BLM and oil and gas.
I think that as a practical matter, it's more about conserving wildlife habitat from, from a big picture perspective at the state and federal level. And I don't know that individuals have to be experts on oil and gas development, leasing, permitting procedures, so much as understanding the value and the need for conservation of that habitat. I think that's really the focus, based on conversations I've had to date. So I don't know that anyone needs to be an oil and gas expert. That said, I am the oil and gas liaison for the county to the extent that fortunately, it's a pretty limited role because we have so little development. And Laura Maker in the attorney's office also is very involved in the Colorado Oil and Gas Conservation Commission rulemaking process. So she's also very familiar with COGCC's regulations. So between the two of us, we have a reasonable background to bring to the conversation.
So would you be the point person like you were with George Newman in previous years when he was our BLM rep?
Well, the memorandum of understanding asks that the county designate a principal representative and an alternate representative, so that in the event that's.
Yeah, they would like an elected to be there when, and we don't know what, that could be in a meeting that we don't know that they're gonna have a decision.
Can the alternate be the elected?
I assume, yes, I think so.
And is the CPW involved? Are they at the
I'm
table?
almost certain they are. I haven't seen the list of agencies, but I'd be certain that they are also involved. Yeah.
So, Steve?
So I kind of have to bite my tongue. The best thing the BLM could do or the federal government could do for helping wildlife is to quit doing
kidding.
oil and gas leases on federal lands in the United States and quit burning fossil fuels. And that is the one thing that could help wildlife all around the world more than anything else. Now, I realize that's probably beyond the scope of what they're talking about here, but
Well,
that's the reality of it to me.
I don't know what's beyond the scope, if anything, and to be honest, that's one of the values of having an elected official at the table, because I can say that as a staff member, but if it comes from an elected official, it carries a lot more weight. So when we get to those points where there may be decisions, it really is, at least in my last experience, it was very helpful to have an elected official say something to that effect to help shape alternatives or final decisions.
Well, I'm happy to do it because I haven't done much with the BLM, but I am really interested in it, as long as it's not on Tuesdays and Wednesdays.
Okay, so,
Because you're gonna be chairing in that.
well,
Especially if I can rely on you and Laura, because I don't know anything about what the new
Yeah.
regulations are.
I think it's our past practice to have Ellen and whoever was our BLM representative, which is
So
fancy.
if we decide we need a commissioner there, and it's when you need to be chair, I'd be willing to step in for you. I presume that John Messner would be involved.
But we can't have two alternates. We can have a staff and an alternate.
Yeah.
We can't have an alternate to an alternate to an alternate.
So maybe we could wait and see when
Yeah,
they're
let's
going
do
to have
that.
the meetings.
Let's find out when it's going to be. And
Thank you.
I think it's safe to say you'll have an elected official. I mean, if it's on the, what is it, second and fourth Wednesdays of the month, if they decide that, well then, who knows, but,
Yeah, we all need to be here.
yeah.
Yeah.
Exactly. So
Okay.
if they could pick something besides that. it
So
would be
Ellen, you
great.
got direction there?
I do, thank you, and I will, I know the memorandum of understanding needs to be signed to make it an official, make it official that we're a
me know.
cooperating agency.
I'm glad to sign for somebody else to do the work.
But, yeah, so I will, follow up when I know more
Okay.
about timing for
Great.
these meetings. Thank
Okay.
you.
Okay,
Thanks, Ellen.
Phyllis, you have 2 more items?
No, I have one that just says there's a Hickenlooper has a virtual open house going on.
Right now?
It's tonight. It's
I think it's during the time we have our meeting.
yeah, it's at 5 p.m.
So,
So
We-
that's
and I-
that's the last thing I had.
Kelly, we need to follow up with his staff too at the airport. Apparently he still doesn't know anything that's going on, and we've been led to believe he did.
I've had multiple conversations.
And Jennifer hasn't led us in any direction to believe otherwise. Did he understand that he's been brought into the loop?
I don't want to speak for what I think the senator does or doesn't know. I just have continued to request that we would like to give the senator a tour of the airport and had hoped that that would have happened already.
Apparently John Peacock ran into him on the steps of the Stanley or something, and the senator was not quite sure he knew anything about. So I think we need to enhance that understanding. However, we need to do that. Okay, if there's nothing, yes, Steve?
So, president of CSU, they're searching for a new president. I keep getting emails about, they have a survey, they are asking county commissioners to respond to this, what we would like in a new president.
At CSU?
It seems like a
or CU?
very generic thing that we could check all of these really nice qualities you'd love in a president. But it looks like a fairly long survey, and I don't know if Pickens County wants to even be involved in it, but I get the emails, and I think that,
If you want to respond, it's up to you. I haven't gotten an email, and
I think it came about because we had a CSU extension agent, and so I got on a mailing list from them, as a county commissioner.
Wow.
And so I could forward it to you, Phyllis, and
We can look
I
at
could
it.
just fill the thing out. It's like, it seems like all the things they're asking about is qualities you would want in the ideal college
Steve,
president.
if you want to fill it out, feel free. Go for it.
Yeah.
And does anybody else, any of you receive emails from?
From
I
CSU?
I haven't noticed.
Not on a regular basis, no.
So.
Okay.
All right, we are going to adjourn this meeting, yes? We're good?
I have
Everybody
nothing.
good?
I'm good. Are you
Gord,
good?
you're good? Greg, you're good?
We're gonna table it until.
Oh, we're not going to adjourn this.
I'm
meeting.
good.
We're not going to adjourn it. We're going to take a break until 4 o'clock, when we will be back here in this room, ready to go, joint meeting with planning and zoning. Thank you, Steve, for not letting me, and then have to restart again.
And it is the same link as the regular meeting
We're
that
not-
people are
yeah,
joining.
we're not leaving this.
It's the same one.
All right, thank you, everyone.
All right, we'll be. Okay. welcome back. Today is still Tuesday, July 26th. It's still my niece's 59th birthday. And this is the Board of County Commissioners work session. This is a special meeting with our Planning and Zoning Commission. And we have a mystery agenda, not posted, because staff loves to bring surprises with them. So we have members of the P&Z both here in person and online, and we have some members of the Board of Commissioners. Greg is, I think, still online with us. Is that right? Is Greg still there? Greg is still there. Okay, so I'm going to turn this over to staff, and then we're going to share. Jeffrey and I are going to share. We never sure to call you Jeff or Jeffrey, so today you're Jeffrey. Does that work for you? It does. Okay. All right.
All right. Well, thanks, everybody. This is a work session. We just wanted to gather you together to make sure the real reason is to ensure that we are on. We have a common understanding of where we're heading now that you have appointed your advisory, your community growth advisory committee. And so we're here to just talk through some of the details on that and to also confirm what you might think is the definition of success when you're kind of thinking through at the end of this process, what does success look like? And so we want to work through that. This is very casual, so feel free to ask any questions, but we do have a discussion and questions at the end. And first of all, I think what we'd like to do is give you an overview of what the advisory committee looks like and the public outreach structure.
I just saw your agenda.
Yes, this is it.
Would you like to do part of the welcome?
Well,
usurped your
I thought you
welcome
did
time.
that quickly.
That's quite all right. Now, in the room, you've got Suzanne Caskey, who is serving on the Growth Committee, along with Joe Kraybacher and Chelsea Clark, are sort of the three P&Z representatives. And also, assuming we've got Monty Thompson as well. So there's 5 of the 7 P&Z members. And
Zach is not.
We're missing Zach and Jasmine of the 7.
Okay.
So we're looking forward to having this conversation, I guess.
Thank you.
Well, thank you.
If I can do one other on the call. So this is your staff team, and then we've also brought in Miles Graham from GBSM, who is on the call and is also immensely helpful as we work through the effort for the Growth Committee. And his counterpart, Emma Harrison, is the other person that you will all be seeing much more often.
And just of note too is tomorrow we are finally appointing our committee. It's official tomorrow at our BOCC regular meeting.
Mm-hmm.
Okay.
All right.
Sorry, I didn't mean to.
No, that's great. This is a work session, so it's all good. But we wanted to bring up first of all, the structure of the committee that you've seen this slide before. Basically, the Board of County Commissioners has initiated this process along with the Planning Commission, who's been working on these issues for years. And you've appointed a Community Growth Advisory Committee. Staff will report back to both the Planning Commission and the Board of County Commissioners. And we also have a resource team. And that resource team, if you will, is comprised of P&Z members. Suzanne Caskey, Joe Kraybacher, Chelsea Clark are the 3 members that volunteered from the Planning and Zoning Commission. And we were especially grateful to them because through the last couple years, the P&Z has looked at all the topic items we're going to get into today, and we think that they have a good handle and a lot of great resource and a lot of great background to bring to the advisory committee members from the community. And so they'll be at every meeting, and they'll be there as resources that can help. And if we know as we're going into certain agendas where these guys might be most helpful, we may plug them into the conversation more as subject matter experts. And then we will bring in other subject matter experts as we go along. And of those subject matter experts, we also have consultants. And we'll get into that in a little bit because we've done some research in the last couple of years where these consultants can come and help us understand a little bit more in depth on the topics of environment and economy. So we'll get into that in a little bit more. But we also wanted to remind the board that this is not just a community growth advisory committee and resource team committee. that we've committed to keeping the caucuses informed and other community organizations informed, along with a broad public outreach engagement plan. So we have several plug-in times along this process where we'll be having larger community meetings, and hopefully more people from the community will come and hear about the data and then hear about some alternatives that are being discussed. So we have that, along with some open houses that we plan throughout the process. And with that, we just wanted to remind the board and the P&Z and the public about the board's vision statement, which is the guiding light for all of this. And that is to utilize growth management and the land use code as our tools, if you will, as our levers to create equitable, sustainable, resilient regional quality of life, which is key, and economy for the future, and to meet our climate action objectives. It's a lot packed in, but we hope we've unpacked it enough so that we can work through this process and get the results that you're hoping for. So with that, we have a little bit of history and background that I'll jump into really quickly. In 2020 and prior to 2020, the P&Z was engaged, as well as some members of the public, in creating, if you jump to the next slide really quickly, a series of topic items to discuss. And on the bottom of your screen, you'll see we talked about TDRs, we talked about community benefits, and the current growth management quota system that we have in place in our land use code. We talked about growth and square footage of residential space. We talked about intensity of impacts. We talked about climate change. And we went through a process, if you skip back to the last one, we went through a process of public outreach, and we created that website that you just saw with all the data in that website. So just for those of you watching, if you go to the community development website, I think Alex has it keyed up here, and you can tell us how to get there.
Yeah, so on our community development webpage, you'll see a side panel that says long-range planning. And then on the new page that appears, it's the growth management public outreach. And that would get you to this page if you wanted to see any of the previous work done and any of the studies and reports we have there.
And what may not be obvious is you can click on each one of those topic items. If you click on TDRs, then about 5 different reports come up. Or if you click on climate change, you'll see all the reports that we've had to date come up, or growth and square footage, all the reports to date, except for some new ones that we're going to introduce you to tonight, and we're going to quickly get those on the website for everybody to look at. But also, since 2020, like I said, we worked with some consultants, leaders in their field, to look at an update to our greenhouse gas regional inventory. And we'll get into that in just a little bit more in a second. As you know, through the years, we've had regional greenhouse gas inventories for the county in 2014, another one in 2017. We've worked with the city on several of theirs. And then we work together through CORE as our agent, working with Lotus, our consulting firm, to update our greenhouse gas inventory. Just so you know, we got into 2020, which was a little awkward given the pandemic and everyone staying home and some of our data from that. So we are going to go back and use 2019 as our baseline, because that's going to be the most reliable baseline of data that we have. 2020 was off by about 9 or 10% of what we would typically see given transportation trends. So we're going to use 2019, even though we have 2020 data to refer to, but we're going to use 2019 as our baseline data. We also did something that we think is a lot of fun. Thanks to Zach Hendricks, we created the embodied carbon report. And also thanks to Zach Hendricks, I had to take that over. So we'll be calling our consultants a lot. But the embodied carbon report is really great. And we're going to be unveiling a little bit of that tonight, but not much. And we're going to be getting into that with the consultants in a really heavy duty download here pretty soon. We also have been, and the consultants on that again was Lotus Engineering, and they're also they're out of Crested Butte. We also have our economic analysis report that the board asked us to look at valley-wide impacts. When we look at construction and we look at how our construction industry affects our economy in the valley, we looked at the entire valley, and we also looked specifically at Pickens County, and we worked with our consultants, and I always get this backwards, but it's EPS. Right. Yeah, Economic Planning Services, not ESP. And
we might need ESP,
yes.
but
then we also have been working hard on our master plans to get those updated so that we have community input from the master plan level. We're still working on several of them, but we've got several more updates, and we have a good handle on where we are on the other ones as we embark on this process. As you know, master plan processes really involve community, and they tend to take a lot more time than you anticipate, or I have anticipated. So then the growth management process, we tried to, over the last couple years, educate a little bit more of the public through grassroots television and doing a series, a history series that I hope you guys all remember. Bob Broadus was here with us and came to help us understand growth management and some of the history, as well as we had clips from the wonderful film that was made about the beginnings of growth management and that whole era from Freak Power, the movie that we'll have available for everybody. And then also we did a current growth management process session where the people who know most about it, Suzanne Wolf, Leslie Lamont, Tammy Conchin all came and discussed the growth management process today, what's working, what's not working. And both of those history sessions and the current growth management process session are on, they're archived, so people can go back and look at those. So we hope that our new advisory committee doesn't mind homework, because we feel like it's probably the most effective way and efficient way to bring people up to speed as we get into our conversations. So with that, let's see, we've gotten through those. The board met again in April. Once again, a small mini retreat, but you reaffirmed what your real goals were with this public outreach. And those are pretty simple. They're not easy, but they're simple. And they're the climate action goals that you have to reduce greenhouse gas emissions by 90% by 2050. It doesn't say that right here, but it's by 90%, which is tracking with the governor's request of the state to try to reduce our overall greenhouse gas emissions 90% by 2050. Also, you had reiterated that you wanted to reduce our residential greenhouse gas emissions to net zero by 2030. We've done a large jump on that already with our current updated 2020 energy code updates that you approved on April 22nd, Earth Day 2020, and we've seen great design changes and hopefully some great results from that we'll see more with measurable items as we go forward, because now we're really collecting great data that we can share through our new SAGES tracking system. So the other goal that you had is the quality of life, and that quality of life, you know, it's, as you'll see later, we all know that that's interpreted different ways, and we want to leave a lot of room for that for this committee to look at. But for the board and for your direction, it really had to do mostly with environmental sustainability and climate action, as well as a healthy and inclusive economy. We all know the elements of that just have huge drop downs, and we can get into those, but we didn't want to get into the weeds here, and we're going to leave that hopefully for the advisory committee to start digging a little bit. And with that, we wanted to give you a brief update of our 3 new studies. And like I said, this is high-level overview. Our consultants will be coming, and they'll be helping us really dig into the data. But,
Sure.
Kara.
So again, as Cindy said, you know, there's so much work that P&Z, that staff have really done getting us to this point. But, you know, hearing from the board, myself coming into this process pretty new, is that there's a lot of energy, no pun intended, sorry, on these studies. And so we wanted to use this time with the joint P&C and the BOCC to kind of give a preview of the data that we're getting, as it helps to shape, I think, where we're headed the next part of this conversation, which is really what is the scope of work for the committee. And so that's why we're not getting into details. We have a plan of how we're going to share these results, both with the boards and the community at large, and so we'll share that later. But just, you know, keeping that in mind as we go into this quick overview of the key new data reports. So with the greenhouse gas regional inventory, again, as Cindy said, it's an update really to those 2014 and 2017 with more specific sector details than have been done before. And so I won't go into the hard numbers, but, you know, in 2020, there's 506,459, not 658 if you want to be precise, metric tons. This was a 9% reduction in emissions from 2019, which is where Cindy said we are going to be using that 2019 as the baseline for the 2050 goal. And then really, I think what's important as it relates to this committee is seeing that the largest share of emissions were activities in the unincorporated Pickens County. And that really starts to hone in the focus of this growth advisory committee. So
that includes the airport?
Yes.
Mm-hmm. And so, again, we will have a lot more to dive into details. I know this chart is kind of hard to see, but the key elements here is buildings really are the greatest source in unincorporated Pickens County of emissions, representing 28%, with, you know, 38% is electricity and 16% is natural gas. And then we can go around the wheel, but really it's that buildings, and then you get to transportation, which is 37%, and then that waste element makes up the 6%. There's a lot more, and I think this in of itself starts to dive into where it leads for opportunities for that committee, based on the direction from you all today, to really start to come up with some innovative solutions to meet the goals that the board has set. And then I'm handing it over to Alex to do the economic study.
Yeah, so we conducted a regional economic analysis, not just looking down to Glenwood, but as far as Rifle, to understand how the area's changed and recovered since COVID. These are just a few of the findings. I think obviously there's much more here than we can represent in all of these studies. But when we're looking at the community composition, we've seen a decrease in working age population and a decrease in the presence of full-time residents. While I think you've seen some numbers before saying that population overall hasn't decreased, it's because there has been an increase in the senior population, which kind of masks that. We've also seen an increase in second homeowners and part-time residents. Really, I think kind of speaking to what we all know is that the local full-time resident is disappearing, and we're seeing more and more of second homeowners. When we're looking at the economic health, it's really not an increase in visitors, but an increase in visitors that have a wealthier spending potential. So we're still seeing the same numbers, but overall sales, and I think that can, we see that in the sales tax collection that the city's been reporting on as well. When we look at what does the I guess jobs really comprise of here, We're looking at accommodation, food and service, arts, entertainment, recreation, retail, trade. So a lot of those that were affected during the pandemic but have come back and have really bounced back in force, as we see with the wealthier visitors. Then kind of looking at the fiscal health, to touch on that. Private air traffic is up, but commercial air traffic is down. Again, I think it speaks to this, that there are wealthier individuals able to come in on private jets, and the everyday local or family that's trying to visit, they are not coming in via commercial air. Tourism economy is strong, and we're seeing a higher demand on those, but we see a struggle for local businesses to maintain their foothold here, when it's more of these specialty businesses that are really getting the demand felt. Those are just a few of the components, the ones that we thought we'd really run a report on. There are other areas that we'll come back and give you an update on as well, in regards to the economic health of the county and the larger Roaring Fork area.
Okay.
May I ask a question now?
Yes, we're both saying yes.
Where did you include real estate in the list that you were just mentioning?
We do have a whole section on housing, regarding affordability, a lot of other sectors, but we thought just for this presentation, we were going to wait until we had our consultants come back and give kind of that full update, because there were a lot of pieces to that.
Okay.
So we do have that, yeah. But.
Thank you.
I'd like to also mention something, and it drives me nuts when I see it come up in presentations. Are you sure that because there's an increased amount of plane traffic, that means that more wealthy people are coming, or that have the ability to charter a private flight, or is it just the same people coming more often? Because I think there's an increase in traffic. So I think that actually people that are more middle class are coming here more frequently in their cars, perhaps not by plane, which would be an explanation for why commercial air traffic may have decreased. And I wouldn't just assume that increased private jet service activity means that more wealthy people are coming here in lieu of more middle class, if that makes sense. I feel like it's unfair to always have the tone of the wealthy people are in the wrong for being here. They have every right to be here too. So just wanted to set that out there.
Yeah, that's a great point. We can follow up with our consultants as well and see if they can give us more clarity on that private jet traffic that we are seeing. If it's repeat or new traffic, we'll see if that's something they can look into.
I can tell you they can check a lot of it by tail numbers on planes. They know, but the problem is we don't know how many people are on those planes. We don't have a deplanement or an enplanement count for GA. And Chelsea, I don't think in any way we're saying they're bad or they're wrong for being here. I just think it's a matter of statistics. And the airport can give you more information onto those wing numbers to see if it's the same plane. But a lot of them are the same planes, bringing in different people, drop off mom and dad here, then go pick up the kids at college and bring them back. We do have that kind of transportation through GA that we're seeing increasing and more often.
And I think just one thing to remember in this big picture of it's like, why is there an economic analysis when we're talking about land use and square footage? And I think just to put it in, kind of the bigger picture is really, I think what was learned from the past efforts is if you're doing some dramatic changes to the land use code, I think there's a lot of questions of how does that impact our economy, recognizing that we have a regional economy. And so part of the reasoning for this analysis is really to understand what is our regional economy right now, especially after COVID, so we kind of have a baseline to start to look at what are those impacts, what are the levers and the impacts of those levers as we look at the land use code. So while all of the economic analysis is very fascinating and each stat in of itself is a whole nother story, I just wanted to call out that the bigger reasoning for having this is really to understand how all the elements of our community are interrelated and give that baseline as we move forward.
Well, I think it's a good point because we've been asked by the public, if you're going to make changes to the land use code, how is that going to affect my economy as a builder, my economy in real estate, my economy is in retail. And so I think this is going to help us to kind of lay a clear path as to the interconnections. Kelly?
Just a simple question. In these slides, are you guys presenting the summary findings from the consultant reports? Or are these staff summaries?
There are highlights.
Okay.
They're not the complete summary report by any means.
Sure.
They're just the highlights that we thought were maybe the most interesting to bring to the board right now. And so, you know, we have posed some pretty tough questions to our economists and asking them questions about if, in fact, you do this, what will that do? You know, it's the if then. And very interesting research and answers are coming out. You know, we have such a resilient economy here. I'm surprised and not surprised by some of the information that we're getting, but they're not quite ready to share all that yet, and they will be with us soon.
You guys are just teasing us.
I know. We're just, you got to come to the next meeting. So, anyhow, if we could move on to, I think.
Just want to make sure, Chelsea, your hand is still up. Did you have something more before we move on?
No, thanks. Thanks
Okay.
for reminding me to lower it.
Just didn't want to miss you. Didn't want to miss you.
Her arm's getting tired.
No, I appreciate your feedback. Thank you.
Okay, great. So the embodied carbon study, again, done by Lotus. Embodied carbon really does talk about, for us in this context, in construction and residential development, is the life cycle of emissions for a building. And I thought this was a great little graphic that is in the report that basically says it's everything from when you start to extract the materials. You know, I have a vision and I want that marble, you know, from Mexico or from wherever that I like. And, you know, they extract that material, I buy that material, I transport that material, I manufacture that material, then I transport it to my site and I construct my building. And then I have also included in embodied carbon is the actual energy use and maintenance, or the operational aspect of my building. So we also know that homes in the country have an average lifespan of about 39 years. That's an average home lifespan. But we know that that's a little bit shorter here for some of our buildings, but not all of them. So we don't really have a great average, but we're using an average in our equations so that we can, you know, make some decisions. But then you have to demolish those buildings. And what happens there is you haul away that waste. And then what happens there is we take that to our landfill. So all of that is what we call embodied carbon. All the energy, all the carbon emissions that has from the beginning of that cycle to the end of that cycle is what we're talking about with embodied carbon. You look like you want to say something, Jeffrey. No? No?
That explains when I asked you what the definition of embodied carbon is.
I love it.
It's perfect.
It's great. So with that, just another teaser, Francie, is that I pulled these out because I think these are the most interesting things. That maintenance of homes has greater emissions than the construction of a home.
Wow.
And primarily due to the transportation aspect of the maintenance of those homes.
So crazy.
And you guys, what these consultants have done will just fascinate you because they have been able to track, you know, how much maintenance basically per square foot of a home. And then the other interesting thing is that the homeowners associations, managed homeowners associations, end up having fewer trips than individually managed homes. And that's probably just due to coordination with a management company at a homeowners association. So it's very interesting with just a little bit of management how much you can reduce emissions, you know, if you really think through that. And so also it just shows us here the great opportunities we have to work on some of the transportation side of our management of homes. And I want to do a quick shout out and thank you to those who helped us with this study. We had dedicated people in the home management business as well as the construction business that basically turned their books over to us and said, here, we want to be part of the community, we want to help. Here's our data. So we really appreciate their help. So with that, we're gonna jump into the statement of purpose and the scope and vision. And this is where it's a little bit more work for you guys to have to think through and make sure that we captured everything that you, both P&Z and board, feel is the actual scope of work that we're assigning to this advisory committee. And what we tried to do is we tried to capture what we've been hearing from you over the years, and we tried to put it into a formula, if you will, that is understandable, because we're bringing people from various walks of life into this committee, and we wanted to kind of make this understandable in a way that basically we have all these different elements that make up our quality of life in the community. And we have certain tools or levers that we as a county feel we can affect, either to make positive change or negative change with our land use tools. And we, over the years, have really thought through what those most important land use tools are. And we just don't quite know the proportions of what needs to happen to end up with the best recipe possible for quality of life in this community. And so, hence this statement. So, if you'll follow along with me, I think it hopefully says what.
Good.
All that was missed.
Could you repeat that, please?
Yeah, you gotta start over.
37 years. Okay. Hopefully you'll safely get that. But, so if you'll bear with me, I'm gonna kind of read through this and we can think through it as we go. But the land use decisions directly shape our community in many different ways, as we know. They may be one of the most influential factors in driving both positive and negative community impacts. And the county's land use code can be thought of as the levers that can be used to adjust those impacts one way or another. How we choose to use and manage our land is a powerful tool and in defining the quality of our community. So with that, you just think about if we say, okay, we're going to build a concert hall right here, then you think about all of a sudden, wow, that neighborhood's impacted by that traffic that comes into that concert hall every night or every weekend, or that community is affected by the noise of that or whatever. So our land use decisions really do create impacts, positive and negative. And then we think about our quality of life as the way our community looks, feels, and functions. It can be made up of many ingredients and is certainly open, as we said, to other individual interpretations, which we hope to bring out during this process with our varied community members. But its core components are deeply rooted in our shared community values. And I don't know if you guys remember, but we had extensive surveys a couple years ago about community values. And so we're reaching back into those community values, and we're also hearing from the board and the P&Z about what those community values are, which are environmental sustainability and climate action, a healthy and inclusive economy, equity, and affordability. And with that, as I said, we've spent a lot of time deliberating. The P&Z, thank you, for over the last, 4 years, has come back and forth to this topic a lot and has helped us with the community conversation. And as you know, we went out in 2020 with a 9-week series and had about between 18 and 25 people show up every week to talk about these issues, those topics that we saw across that toolbar of TDRs and growth management quota system and house size and all those things. So we thought about all of that, and the county has identified a preliminary list of land use regulations that have the most influence on these core factors of quality of life. The Community Growth Advisory Committee and the associated public engagement process will consider the following factors, identify other areas of potential focus, and ultimately develop recommendations for the Board of County Commissioners and Planning and Zoning Commissioners to review. And the main regulations that we have those levers for are our residential house size, our residential redevelopment, growth management quota system structure, if you will, and transferable development rights. So that's kind of the focus that we see. We'll talk about whether or not we've missed anything here in a little bit, but those are the primary focus, if you will. And in order to find that recipe that I talked about for the quality of life, the board, we're putting words in your mouth, but we hope these are yours, believes that we must rethink our land use plan. Smart development strategies, including both limitations on certain regulations and mitigation on certain forms of development, are needed to align our community values and our climate action goals. As citizen advisors, we're asking them and we're tasking them to give the board recommendations on a recipe that includes the right proportions, if you will, of all these ingredients, and that we need for the quality of life that we want in this community over the next 30 or so years. And in order to guide those deliberations, the board has established some goals. And those goals are clearly stated as a reduction of greenhouse gas emissions by 90% by 2050, residential net zero by 2030, and creating a healthy level of economic vitality. So that's the scope. And if you guys feel that that's clear enough, or if you feel like we need to add some things and discuss all this, great, that's why we're here. But the intent is that if I'm a member of this new committee, and I've never worked on anything like this before, would I understand what you're asking me to do?
So, first of all, Greg, I just want to let you know, my battery's out, so if you have a question, jump in, or Kelly will help me, but Kelly has the floor now.
Okay, I'll be next.
Okay.
I just saw your hand go up, Greg, so I'm going to let Patty know when hands go up. I guess I'm wondering if this is clear. I'll start with that. Thank you. I'm wondering if you think that there will be any elements of the conversation that will come up related to zoning.
Yes.
Where will a conversation related to uses inside the urban growth boundary live?
Yes.
Or something like that.
We anticipated that question.
Okay.
And we think that we didn't want to get in the weeds and list everything. We did have land use patterns, which is zoning and all of that listed, and we took it out because we thought that really the study of growth management and a system that incorporates zoning and all of that will incorporate that question of land use patterns.
Okay.
So
appreciate that clarification.
And Greg, before I let you go, I'm just going to tag on to that. I didn't see anything with commercial. Do you think that's just going to get folded in, or?
Thank you again for your question. We anticipated it. Does somebody else want to answer?
They fed them
Does
to
somebody
us.
else want to answer?
You're on a roll.
Oh, okay. While we looked at our overarching greenhouse gas emissions issues, and the biggest lever that we have is residential, we thought that, the county definitely has commercial and industrial, but to the largest extent, over 38%, almost 40%, really is in the residential sector. And that's where we have the most activity, the most turnover, if you will, of building permits, the most redevelopment. So we felt like we really needed to focus on that, not so much on the commercial right now.
So I think that'll get folded in. So, okay, Greg?
Yeah, thank you. I was going to say, I think if we're going to try and reach these very ambitious goals, climate goals, commercial needs to be incorporated in that, and it sounds like you've got it teed up. It's just not the first thing. I'm really interested in hearing from our economic advisors. I hope we don't only see them once. You know, I hope we have opportunities to interact with them and really dive into what they're presenting and help shape their study, as one comment. And then the other one is, it's interesting reading this. It's funny that it's called the Growth Advisory Committee, and everything's pointed in that direction, but it seems as if maybe by intent you don't really talk about growth. And so the questions I wanted to put before this committee would be, when we were interviewing applicants, I felt like I wanted to remind people, this isn't about streamlining the building department. It's not about, whether or not we need more affordable housing or where. It's about, it's a growth question about where we might want to be in 10 or 20 or 30 years, say 2050. So some of the questions I'd like to have in there, and maybe they're so obvious that they weren't necessary, but it's, how big is big enough? How much growth is acceptable, if any? If it's time to stop promoting growth, how do we do it? How do we maintain a healthy circular or steady state economy if it comes to that? And that's something I want to explore. I'm not promoting that right now because I don't know enough about it. But what I'm wondering is if the charter for this advisory board it will include the possibility that, the sentiment that I'm perceiving in the community is that, hey, we're already too crowded. What are we doing? So maybe it's time to assess that in a more direct way. And I'd like to see that in the directions for this committee. And whatever they come up with, I just want to make sure it's very clear that that's one of the things I'm hoping they talk about. Thanks.
Greg, it's very interesting because our growth management quota system today really was based on the number of units that we have in our community. That hasn't changed. We really haven't changed our zoning to do major downzonings for quite a number of years. So the zoning part has changed. We're not really talking about that here. We're not really talking about, it's very interesting, as Alex was saying earlier, our population is not growing, but the intensity of our community is increasing. And that it's so layered in how many people are staying here longer, how many more people are visiting in our tourist accommodations, how full are we, all of that has to do with it as well. The number of actual units, and then if you count the, average number of people in those units, really hasn't changed. Our population has not grown. So, there are factors that we really need to dive into and look at to reach some of these. And we got very specific on these goals because we knew we couldn't address it all. But we knew we think we know what the most important thing is to address, which is the climate action overall.
I guess I wonder, Greg's comments triggered for me a question about if there is an opportunity to understand what has generated, the slow growth that we have had. Like, will this create a picture of that for us?
Population growth.
No, I don't know. I mean, I would think it is population growth, but is it growth in sectors at the expense of other sectors? Will we leave with a clearer picture of that?
One thing I may offer, we've had this debate internally too, and then even because it's hard to put to words what we're all feeling, right? So maybe one thing I would offer as a charter for this committee to help answer some of these questions is to have them come up with what is the collective redefinition of growth, right? We're no longer talking about population growth, and so is it something that we charter this committee to say, help us answer that question, because they're going to go through all the different data that's going to help paint the picture and for them to say what is the growth, because it's a growth and an intensity by sector, by visitors, and help us redefine what that means, that then can help lead to some better outputs.
Okay, Francie?
Yeah, I just wanted to respond to what Greg was saying. A lot of what you were saying, Greg, I think is related to carrying capacity, which one of the applicants had written on his application. And obviously, we all have a different understanding of what carrying capacity means. Some of it's just purely biological. It comes from biology. And some of it is more about how much more impact can we allow to come here, and that's that kind of carrying capacity, not necessarily how much more than 17,000 people are we, you know. I mean, I think in terms of the workers who come here and the skiers who come here and all of those things, there may be more growth than we recognize in terms of population numbers. Our full-time population numbers haven't changed very much, but I do think if we can figure out how to talk about the carrying capacity, not just in the biology term, I think that would help us understand what's creating the tension around the word growth right now.
Thanks, Francie. If I could respond real quick, Patty. You know, John Peacock put me off of the term carrying capacity because it's so subjective. For instance, I checked out Hong Kong, which is about the same number of square miles as the Upper Valley of Aspen, and I think it has several million people. So their carrying capacity is a million people per square mile. So if we want to put it in those terms, so I think capacity isn't the question as much as we have to redefine it or define it in such a way that it really has some meaning, because as you said, one person's idea of crowded is not the same as someone else's.
Right.
Thanks.
You got to throw in quality of life into that one too.
And that's what I meant about the biological definition. Is it's about density. How much density of this particular species can this particular land hold? We need to think beyond that about what is the carrying capacity in terms of impact, I think.
Steve?
A couple of thoughts I've had. One, we could achieve our climate action goals just by making a really strict energy code and also mandate that everybody have electric vehicles. So all the houses that are built could be net zero going into the future, and all the service people driving to big houses without changing the house size could all have electric vehicles. So their impact would not be that great in terms of the climate action goal. It would actually be an improvement. But I think the quality of life would be degraded. And I look at Snowmass Capitol Creek, the projected build out there is about twice as many houses as there are right now. It's 300 and some odd that are existing. Now this compares to 20 houses that I can count in 1961 in Snowmass and Capitol Creek. Now there's 350 some odd or thereabouts. And the projected build out would be about another 360 or something potential, the predicted build out, which I think is like, you could call that 60% of the total potential build out.
I don't have those details in front of me.
But anyhow, my point is, I would think that doubling the number of houses in my neighborhood would lead to a decrease in the quality of life in Snowmass and Capitol Creek. So much to the point that, some people might want to move somewhere else, just get out of there, because it would be so much different. And in my lifetime, I've seen the 20 houses go to 300 and some odd. And that's like huge. It's way different than it used to be. It was all farms and ranches in 1961. And now it's half of it's second homes, and bedroom community, people commuting, lots and lots of cars on the road. So I think Greg's point is that the carrying capacity is an important issue for the committee to look at because it affects the quality of life. We could achieve it with being net zero carbon, reach our carbon goals and have twice as many buildings, but the amount of traffic and the quality of life, I think, would be very much degraded. So what Greg is saying, I think, is important, and I hope the committee could look at that.
Okay, Jeffrey, I'm calling on that chair over here.
So one, I applaud you for adding the economic justification to this discussion, because that was, I think, the biggest pushback 2 years ago, 3 years ago. So we really didn't know the impact on the building community or on the planning community or on residents, or full build out. So I think that's critical. I would recommend the energy working group that preceded the growth working group was highly successful. And that resulted in significant changes to land use code that are in place today that probably could be tweaked, but have had a profound impact on the built environment. As you're looking at 80 new permits probably in the building department now, they're all subject to that new code. So there was something that came out of that working group that was incredibly successful. It was a cross-representation of architects and engineers and highly representative of the built environment, but it was I think a really good example. And so there are elements of that working group that we need to make sure that we, as you onboard them the 26th tomorrow, we have that same modicum of success and impact on the land use code. Third, the term steady state or carrying capacity. Carrying capacity comes up anytime you read the NEPAs and you read all of the U.S. Forest Service stuff regarding ski operations. So that's where my brain goes. But steady state is something that is inherent in the neighborhood, meaning my backyard in Capitol Creek and Bohan Gulch is BLM land, and then the front yard is Forest Service land. So our neighbors are actually not going to build, which is great. So we hope. And so I would say, we have these amazing neighbors, and that's the attractiveness of the valley. So 2 of the 3 players are pretty good at managing growth: the U.S. Forest Service and the BLM. And I throw that out there jokingly, but I think that is part of the constraint of where we are. And lastly, sort of a non sequitur, but if everyone read Jennifer Stuber's book a couple of years ago, it was about super gentrification. And the relevance to this is that part of what we're feeling in terms of carrying capacity or growth is that all of these people were designed not to live here, right? So Jennifer Stuber's book was, she's a Snowmass resident or part-time resident who spends more time here now. Part of the premise was that the people that own second homes don't vote here. They vote in their primary residence, and then they visit here occasionally. And I think part of the perceived growth is that all of a sudden the second homeowners are actually domiciled for the last couple of years here. And so we are actually a busier community. And so that's my 2 cents for this conversation. But I think we've seen success before. I think the biggest point in the energy working group, we've seen an amazing cross-section of the community participate. And I think the adoption and what we brought out of that working group was pretty spectacular. And I hope the same out of this group. And again, I think the BOCC support going in is that economic justification. In addition to, we now have a picture, what we looked at before with the energy working group was really the operation and maintenance of a building. And now you have the operations, maintenance, plus all the inputs, right? Operations and maintenance was renewables, on-site, pivoting buildings, driveways, all that stuff. And now we've added this other factor, which is all the energy that goes into it. So we sort of have a consumption and production look, which I think we didn't have 2 years ago. So
And destruction.
Yeah.
And destruction, yeah. What was the name of the book?
Jennifer Stuber's book was the Super
Aspen, the American Dream.
What?
Aspen, the American Dream.
And it was actually the plot, not to give away the real ripping, it was really about the moratorium that took place, not the current one, but a previous moratorium in the city and the changes in the land use code. But it really was about voting and impacts on citizenry and growth.
It's at
I wrote
Explorer
Cliff
Bookstore,
notes
and I
on
think
it.
it's about $30.
Thanks.
But if you want something that's more enjoyable, go read Friedel Pfeiffer's book, My Life on Skis.
I have read part of that.
I just
That is
used
the best.
crawdads.
So, thank you. Sorry if I digress.
No, that's awesome.
Suzanne Caskey has her hand up quietly over here.
Do you have more that you want to go on with?
We will, but go for it.
Jump in while you have a chance.
Oh, that's good. I feel still a little burned by having served on the growth committee in, what was that, 2020, where there were some pretty specific recommendations. And I think 99 people had signed up. You know, it was a voluntary sign up if you want to. I'll bet that at max there weren't 20 people who attended every time. There were maybe 10 or 11 who attended every time, and you knew that they were there. I mean, they didn't just turn on a computer, black out the screen, and go have lunch or whatever. Very few people actually spoke up about issues, and then it was predictable, of course, with the situation like that people were going to hide out in the bushes, and then as soon as it came to you, they were going to bring out the bazookas, you know, and question the study, question the way it was done, question everything about it. And apparently when they came to you, they were pretty strong and loud and upset about it. And so, and there was the pandemic. And so one of their arguments, as I understand it, was we can't all get together and talk about this, and so we need to put it off until after the pandemic has settled down a little bit. So I fear something like that again, and I hope that you can find ways to come up with some strong standards for accountability in the 26 people that are coming along. I know that you can't treat people like children and tell them exactly how to do it, but I also know that in many years past, Joe Edwards was no longer on the Board of County Commissioners, and he was practicing law again, and he represented a client on some land use application, and he had the feeling that maybe P&Z members weren't reading the packets, and he asked us at one meeting, "Are you?" And we said yes. And before the next meeting, he made each of us appear to sign an affidavit at the clerk's office, at the clerk's office, to say, "I have read the packet and I understand it."
Wow.
It really made me mad because it made me feel like a child. But then I understood his reasoning. And so the only thing I could do then was sign my name as big as John Hancock's, you know. Yes. That in mind, though, or that aside, if this 26-member committee comes on, can you, and it's on Zoom, is there a way that you can prohibit people signing on, blacking out, and going their own way? Can you require that they be seen as if to attend means you are seen at attending a meeting? So I have a really strong feeling about that, because I know there's still a chance that at the end of everything, people will question the way it was done, question the time of day the meetings were held, question the statistics that were offered, all of that. So that's one plea I have of you. Another is, when you had the interviews, did you ask the question, do you believe in climate change?
In some cases we did, but not all cases, because people were very clear in some of their applications.
I see, so you don't think we've named
And
climate
can I just
deniers?
respond really quickly? Suzanne, you've asked me that before about blacking it out.
Mhm.
I mean, the people who do that.
Technically, we don't have control over that. Sometimes people, because of their reception, we can't see and hear them at the same time. And some people, we don't want to see them running around their homes naked.
Well, I understand that, but I'd rather see them running around naked than not see them, than to think they're
that's a
doing
good
something
point.
else.
I remember you saying this at the last time you were in
Yeah.
here on the board, and, and I agree with you. I'm hoping that this committee will be face-to-face for a lot of the time, and that Zoom attendance will be rare, and maybe that's something we can put out on the 15th or 17th. What is the day of that meeting?
18th.
When we meet, what?
18th.
Okay, 18. So that, I just really think, at RAFTA, we've been talking about this the last 2 meetings, about whether we should continue to allow Zoom attendance. And, we decided we would, but we really encouraged live attendance. And so I hope we can do that somehow with this.
Well, sometimes we just have to, but unless you have something to say, Greg's had his hand up for quite a while here.
Well, I have something else to
You've
add.
got some more? Keep going.
Mm-hmm.
I just wanted to respond to Suzanne. No, thank you. Go ahead, Suzanne.
Okay.
Going back to the mission statement, I felt like that was a little watered down from the way it was stated when you had the Volunteer Growth Committee. And that mission statement made it very clear that all decisions would be looked at through the lens of climate change. And I think that that's actually, those were actually the words that you used. If we don't make that really clear, that every single decision has to be looked at through that lens, then we'll be going back to what we've always done. You mentioned it at the end.
It's in front of us now. It is mentioned at the end, which was interesting that it came in at the end. But I can tell you that in looking at in my opinion, looking at the makeup of this new advisory group, we have a lot of people who are not going to let that slip.
Well, I'd prefer that you have it as a stronger statement from the BOCC, so that you just can't, it's like, and at the end, and to meet our climate action objectives, because it's my impression that the reason you're doing it is to deal with climate change locally, regionally. Either that, or it's just time to look at the growth patterns and the growth policies again. And I would much prefer that it be under the microscopic lens of climate change, and it allows people, when little decisions are being made along the way, to always ask the question, what does this have to do with climate change? How does it look if we look at it through the lens of climate change?
Yeah, and I don't disagree with you at all. I think in some cases we have members of this community that are in certain industries that understand the need to look at our climate action objectives, who don't necessarily feel that desire, that connection with looking at everything through the climate lens. But I don't know how we can better word it to let this new committee know that's the key to opening the door to any of these other things.
Well, I think Suzanne said the wording that could make it better is put through the lens of meeting our
She's
climate
saying
action.
everything. I think there needs to be a balance in there, because I don't want to lose any of the people that might be on the other side of the table. I want to bring the community together as we move forward to get this done in the best manner possible, with, I think, meeting the climate action objectives. And that would be technically looking at everything from house size to what kind of glass you use in the panes in your front door.
You could put it first.
Yes.
Maybe move it up in the ranking.
Or look back at the mission statement for that particular volunteer committee and see if you think that that's strong. Now, I'm saying this because I am assuming from what I have heard so far that is why you appointed the 26-member committee. That this is supposed to have everything to do with what we can do climate change-wise. If because you mentioned economy and other things, if those are, the economy doesn't matter at all, if we are not dealing with climate change. I mean, we might as well just all go jump in the lake.
We had a lake to jump into.
That would be a good thing to discuss. I mean, today, this was on the front page of, I don't remember which of the papers, finally some relief for hot water and stressed fish. A pioneering effort uses releases from rudite to cool river temperatures. You know, we can't do that.
That's
We
my
can't
son's
just keep
economy right there.
piecemealing it. You know, we just have to, we have to be really bold, I think, this time.
I've got Greg and then Kelly want to, but I think maybe just addressing that, moving it
I'll
up,
be
maybe
quick.
ranking. Okay, go ahead, Greg.
I'll be quick. First of all, I wanted to thank Suzanne for bringing that up. I do know there are people in the community, I think John Doyle mentioned the other day at another meeting that he was so disappointed that, you know, and pessimistic about this committee because he'd been on the previous one and, you know, everything got short-stopped. And so there was some frustration, but I also think a lot of good takeaways came from the work of that group already. And so we're not throwing the baby out with the bathwater, I hope. Maybe Cindy can elaborate on that. That, you know, progress was made and we're going to continue on it and try to get farther. Regarding the climate change is the existential crisis. I'm completely on board with you on that, Suzanne. But there are ways to solve climate that could possibly lower the quality of life in huge ways that we haven't even contemplated here. So the quality of life issue and you know, having a sustaining economy is certainly important. So I take what you said very seriously. And I felt like that statement was fine for me, but if anybody wants to wordsmith it, I'm okay with it. I know the climate change part will be in there. But I think if it's only about climate change, we may be throwing out all sorts of issues about quality of life, aesthetics, growth, all that. Thanks.
I am unaware of anything that came from that growth committee in 2020, that anything different is happening, or that the discussions are any different.
Well, you could be right. I'm just thinking the way it's teeing up, it's teeing up with more sophistication and some wisdom added to it that we didn't have before.
The only thing that we have is documentation of that committee's work through the form of adding the committee's recommendations in the matrix that we have about all of those issues, what the board had to say about those issues, what the P&Z had to say about those issues, and what the committee, the growth committee in 2020 had to say about those issues. And then we have the documentation of those meetings we can go back to. And we have, actually, there's some, if anyone here or anyone in the public would want to go back to that website, we have about maybe 7 or 8 videos we did with individuals that were really good, talking about what they thought about the community and growth and character and climate. And so we do have the documentation, but you're right, there's been no action taken with any of the recommendations.
Yeah, and I'd hate to see us go through all of that much more intensely again and end up with documentation.
Right.
You want to end up with action.
Slide.
Oh, good.
Promise.
Okay.
Although I might add that another outcome of that meeting, of those many meetings, was the need to develop and establish more data. And we have done that during the interim, and I think that's going to be a really
That's
useful
exciting.
outcome.
That was the direction given to staff from the board.
That's great.
Okay, so Kelly, and then Chelsea, you're after Kelly.
Yeah, I guess I would just say that, you know, for me, I think that there has been a more intimate knowledge of land use and its nexus with climate change at our board than otherwise would have come out of that discussions.
Good. That's really good.
Has crossed over into land use review and other policy discussions for us, I believe. So I don't think it's been for naught in that respect. I share your concern because I'm a little cynical about some of these efforts, that I do think that it can be used as a strategy to wait until the very end and then sort of jump in with a whole lot of criticism. And I expect that will happen again. I just anticipate it, you know, and will rely on the fortitude of, I think, everyone on our two boards to carry forward the recommendations. For me, what's different is a real strengthened, you know, sort of co-designing of this whole process and of the questions to be contemplated that I think creates more buy-in from the beginning for whatever comes out at the end.
Good, that encourages me, thank you.
Yeah, that's my feeling, but I share your concern. With regards to the vision statement, you know, I feel like we could wordsmith a little bit without undermining any of the integrity of the statement and what we asked the 26 members to do. Simply, you know, by putting meet our climate objectives first and saying, let's meet our climate objectives while creating an equitable,
Yeah, I could see that, yes.
you know, community. Because what happens is this and often gets interpreted as or.
Especially if
So
it's last.
in, you know, right. So in policy conversations, you're like, oh, well, what is the trade-off here? You know, and we're not necessarily looking for trade-offs. We're looking for the path that includes all of it, you know?
Yes.
So I would offer that as a little bit of wordsmithing. I don't know if we want to get into that.
Sounds
No,
good to
I
me.
think that's kind of what I heard in the group, that maybe needs to come first, and Kelly, you're right, the wording would be this, because of this. So,
Right.
okay, Kelly, you done?
I'm done.
Chelsea? Okay, Steve, you're.
Thanks very much. I wanted to just thank Greg for his comments and the point about, you know, not letting one thing draw, for example, environmental considerations that would somehow negatively and adversely affect quality of life. So it's a balancing act with all these goals, and I appreciate Greg's perspective on it and agree, so I don't need to repeat them. And I also appreciate Suzanne Caskey's comments about accountability. And I appreciate her also being on the resource team with me, because I have a feeling she'll continue to hold her fellow committee members or people of the advisory committee accountable just through her presence there. So continue to do what you're doing, Suzanne. And I know I just wanted to echo those comments and considerations. And I wanted to also I'm curious if there's an advanced list of who's on the committee that I can glance at, but I assume that they're all professionals that will hold themselves accountable based on their participation. Although I've seen adults behave badly lately too, so I might be wrong, but I just was curious if I could get a preview of that list of the members of the advisory committee.
And I'm going to add, before I go to the next people in line here, Suzanne, I wear this around my neck, and we should get you one. It says, though she may be little, she is fierce.
Oh.
Shakespeare.
Yes.
My daughter gave that to me.
Oh, that's great.
Greg,
Well,
you
she gave
still
it
have
to a
your
good
hand up. Did
person.
you want to speak again, or can I go to Steve? I think that's a sign. Steve, the floor is
So,
yours.
Suzanne, there were some really important takeaways from the 2020 effort that I think are really important. And I read through all the public comments that are on the website. Almost every one of them was protesting the reduction from 5750 to 3250 for the exempt square footage. It was just ordinary middle-class people who that was their equity in their home was being largely taken away from them. And that was the great majority of all the letters. So I think if we just kept 5750 as the basic square footage that's, you know, the exempt square footage that everyone is entitled to, there didn't seem to be any resistance or very little resistance to lowering the maximum house size to something smaller. So I think that is an important takeaway. As I remember too, there was a lot of resistance from, we were talking about eliminating the TDR program completely. And yet there were 135 TDRs out there that at that time were worth maybe $200,000 a piece or something. And there was, you know, if we eliminated the TDR program, those the owners of those 135 TDRs were going to have their equity taken away from them. So I think it would be important that somehow we need to keep the TDR program going at least long enough for everybody who already has equity in TDRs to be able to get their equity out of that. Maybe after that point, the TDR program could go away, but I think that those two things alone were what drew the lightning to them, that people were going to have their equity, their life savings as in their house was being partly taken away by a reduction in their exempt square footage. Now, the average house size is 3,800 something in the county, so 3,250 is not that much different from it, but it's what's in people's mind that they were losing value in their home because of that proposed reduction.
I don't understand if it's an already built home and we reduce the size, if the county reduces the size, how that is going to affect somebody who has already a 5750 house. I mean, it seems like...
Well, if someone owns a 3,200 square foot house with the potential to have it be 5750, they're not going to build 5750, but maybe the person they sell it to is going to build that. So that's where their equity is.
With TDRs.
Yes.
So then a takeaway from me is that if we can somehow come up with incentives for people to voluntarily reduce from 5750 down to something less, not do the stick approach, but do the carrot approach somehow, that would be one way to reduce, keep the average house size down something, way below 5750.
Okay,
It was my recall of the decisions of that particular committee is that they didn't say they wanted to eliminate TDRs, but they wanted to find new and inventive, very creative ways, different ways to use them that would help the person who owned it profit and would help the community as well.
Okay, I'm going to kind of bring this conversation back to staff because we have about 45 minutes. I think you have more to present. Not that we might not have time at the end of the conversation to go more in
I
depth.
think that you're all teeing up the next slide very eloquently, which is what we wanted to do today is really say, get a collective, what's the definition of success for this group, right? We're not going to get into the details of all the ideas that can come out of the committee. What we intentionally wanted to do is leave space for that creativity within the committee to come up with these ideas. Some of it is building off of what was done by the past outreach effort. Some of it, there's likely to be some creative ideas that we haven't thought of. But what we really wanted to make sure we were collectively walking out from staff, P&Z, BOCC, walking out of this meeting that we all agree what success is. And we've left it intentionally very high level, but wanted to have that conversation. And so really that what we think we've heard is that the definition of success is that the committee is going to bring forth land use code amendments, recommendations for land use code amendments that meet the goals, the 90% reduction, the net zero, by using limitation as well as mitigation to using the ingredients that we have spelled out. And so I think that's really kind of the crux of where we are today, and to your point of what's different, where are we headed with this outreach process, is saying this is the light at the end of the tunnel, which tunnel we're going through, how bright the light is, all those different, whatever metaphor you might want to use. But tasking the committee to come up with this is no easy feat by any means.
So can I ask a question, and maybe it's just incorporated into limitation and mitigation, incentivization. One of the things is what can we do to incentivize people to do the right thing?
I think that's a great suggestion.
So,
Great.
Yeah, that would be interesting to see if this committee can come up with some brainstorming ideas that will work, and it won't. It's like we did with our historic preservation. in a moderate scale, though, not, giving away the farm all the time to save the farm. Or the chicken coop, Francie. Okay, thank you. More?
Kind of a thumbs up. Or did we?
I'm looking around the room, and I don't have a list of people who, I think this is a heavy load, but I think we prepared people when we were interviewing that this is a heavy load, especially the learning curve. We let people know there's a lot to learn. For people who don't know what a TDR is, what GMQS stands for. But those are people that we want to bring involved in this, and people that we I think selected because they were saying, I'm ready, I'm a learner. I'm ready, show me what I need to read, and I'm gonna read it, and I'm gonna ask questions. And that's part of this whole group, is to bring that diverse demographic from across the community at the same table and help them solve the community problems.
Does redevelopment include, taking houses down, what's it called?
Scrape and replace.
Demolition, thank you. Yes. Yeah, okay.
And I just want to add something really quickly, but one of the things is that you hear people talking about, well, if I can build 15,000 square feet and it's net zero, that's great. But you even brought up the maintenance issues. Building the house is one thing. Maintaining it is the carbon, embodied carbon that goes on for the rest of the life of that home, if not increasing as the home gets older, for more maintenance costs, more maintenance time, more trips, more et cetera. So I think that's really critical for everybody to keep in mind as we talk about net zero. So, okay,
Well,
but now what?
it changes character, you know, it changes. Would any of you consider getting really impatient along with me and not saying 2050, but saying 2032? Or,
You mean like tomorrow?
I mean, my fear is that we are going to be, we're driving right now 200 miles an hour, and we're going to, by bringing the reduction in residences down, reducing it, then we're starting to slow. But I think that we might just get up to 2045 and slam on the brakes, and we'll still skid right through it.
I have a feeling it's going to go the other way.
You do?
Once we get this moving, they're going to look at 2050, and we're going to say, why would we wait when we can accomplish it in 2040 or 2035?
Nothing will be left.
And I think it'll tie in with some of the same issues, the greenhouse gas emissions, et cetera, that are coming up from our airport advisory board.
Mm-hmm.
They're looking at 2050 or 2030 or 90% by X and whatever. So it's not saying that is set in stone, I don't think. If they come back, I don't think we're going to budge further than that, but I would hate to believe that we're going to say no to coming in sooner.
Would you consider 2040?
Well, I don't think we can consider that right now without the information and stuff before us.
Yeah.
I don't want to put anything forward that might be a stumbling block or an obstacle, or, but if they came forward with 2040, I wouldn't say no.
Well, your goal that you've set up for them, though, is 2050.
Yeah, but if they wanted to come in at 2040, just like the people at their airport advisory group's coming in cleaner and greener sooner than later. Is that a quote?
So Patty?
Yeah, go ahead, Steve.
Well, Holy Cross Energy had a goal, and they blew right through their initial goal way years and years ahead of schedule, and then reset their goal for something that they know they can achieve.
Right.
And we could do the same on here. We don't need to change the date 2050, but we could hit the 90% by whatever year we can hit it by.
Mm-hmm.
Greg has a hand.
So that's a good, I like your
Where is
thought,
he?
but I don't think we need to change
Where is he?
that initial goal necessarily.
Thank you.
The
Did
committee
you see
could
him?
do it. They could make a recommendation to change the goal for sure.
All right, Greg has his hand up, and then Francie.
Right, I appreciate Suzanne's sense of urgency. I feel it too. We're going 200 miles an hour and we're driving a giant gas guzzler presently. And what it means to let go of that big gas guzzler and maybe not drive it so fast is going to be painful.
Mm-hmm.
And so this probably, I'm looking at these goals thinking, wow, hope and pray that we can actually accomplish something like this. I'm going to be optimistic here. So if we can make it happen sooner, great. I think we may need to define these a little bit more thoroughly, but it doesn't have to happen tonight. But I look at them, I'm wondering, how ambiguous are these numbers, and what do they apply to? This is all new construction, I assume, right? And reducing greenhouse gases in a 50-year-old house that's on natural gas is going to be a pretty tough pull. New construction much easier because we can mandate that. So I'm just wondering how far-reaching is this? I apologize if I don't know the full scope of it.
Go ahead, Cindy.
Greg, it could be anything. I mean, the committee could come up with saying, okay, we could do new construction and get the embodied carbon down by X%. But if we do that and we don't do existing, then we've got this to make up, somewhere else. So it's really that blend. It's the proportion of those ingredients that we hope you are leaving to our creative community to come up with, because we don't have those answers. And, having sat on the core board with you, I know we hear that the existing stock of housing is very important to convert to electric or to reduce energy use in. So we know, and we will have those data points to work with.
And I just want to add real quick, Francie, I know you've had your hand up. I think we also need to keep in mind when we're thinking about electric cars servicing these houses, electric homes that are totally electric, we need to think about the fact we're pushing a lot of our greenhouse gas emissions onto other communities if they don't have renewable sources for electricity. So, I don't want to be pushing the problem off so that we look like we're doing the best thing when the communities around us are getting hit. Because you know what? Greenhouse gas doesn't know county lines or city limits.
You just stole my thunder. I've been waiting here to say that. I wanted to, I know you guys have heard me say this before, but I don't want to do what Holy Cross does in one way. I mean, they're amazing, but I don't want to say we're 100% renewable when really we've just traded. And we're still using coal-fired this and that, but somebody else is using electricity over there, and we traded with them, so we get the credits for that electricity. I don't want to do that, and I want to hope that we could talk to this committee about how we're talking about real change, not what are they called? Cap and trade things, because that to me is just putting off the inevitable, and it's not a global view. It's just, oh, well, we're clean, we're Aspen, we're just so great, we have 100% renewable, when in fact, we really don't. So I want to make sure that we talk to this committee about that we don't go that direction, and
I didn't steal your thunder, you said it much differently. All right, I'm taking it back to staff again.
Okay. Now we just want to go over a little bit of the process with you real quickly.
Are we good on time?
We are.
Okay, thank you.
Yeah, great, thank you. Yeah, so we're anticipating, I get 2 microphones. Can everybody hear me? So we're anticipating a roughly 6-month period for the Community Advisory Committee to work through and achieve their end goal of making recommendations to you all. And we've broken that 6 months into 4 phases. The first phase, the kickoff and process phase, will take place in August, and we anticipate 2 advisory committee meetings. And at those meetings, really the committee is going to be establishing their goals and their structure, how they function. And then we're going to begin to do some of the introduction of data, the very beginning phases. Phase 2 will take place between September 21st and the middle of October. And in this phase, we're really going to be doing the data download, the heavy data download, where we are educating the advisory committee, and we've also incorporated a big community meeting within that time frame, within that phase, so that we can also inform the larger community about data that we have available, and really just to start to bring them into the conversation. Phase 3 will take place between November and the middle of December, and in this phase, the committee will be asked to start to come up with their alternatives, begin to come up with their recommendations. And again, we're going to include a community meeting so that we can continue to include the larger public in the conversation. And phase 4 will take place between January and the beginning of February. And in this phase, we're going to ask the committee to finalize their recommendations. And again, we're going to have a larger community meeting to make sure that we continue to include the general public in the conversation.
Can I just call out one thing?
Yeah.
So the one thing I would call attention to is that October 5th is when we are tentatively planning a large community meeting and really going into detail about the data that you all saw preliminary. So we'll have the embodied carbon, the greenhouse gas, and the economic. We'll have the consultants there, and we're going to do a big overview about that, as well as then some follow-up with the committee.
So the committee's going to be part of the community meeting and that thing all in one day?
Yeah, we're tentatively looking at it, but essentially we wanted to give an opportunity for the community, for all of you, and the committee to really get the
Looks like a
overview
long day.
of the data, and then have an opportunity, as Greg alluded to, for really the committee to ask more detailed questions to the consultants to really get that found, because those studies are the foundation of the work they're going to be doing.
And I'll add that in terms of, yes, that would be a long day, but we will most likely be asking the consultants to return to some later community advisory committee meetings in the event that we need more detail, and to allow the advisory committee to make queries and get responses directly.
What is the one-on-one / focus groups from July 20th mean, under July 27th?
We'll be holding one-on-one meetings with different members of the community or the committee here, just to understand baseline, any questions, feedback they'd like to give, and then start initially giving them some of that preliminary data, where to access it, so that way in the kickoff everybody has the same baseline.
Oh, I see. Cool. What time of day is that kickoff?
I don't know, but it says from July 20th. That was last week.
I know.
Well, we're starting we're doing the interviews as of tomorrow when you appoint them.
Okay.
The kickoff, I will get back. I think we said 4 to 6, but we'll confirm that.
Okay.
Great. Yeah. So that first process, we hope, will take about 6 months. Once the Community Advisory Committee has come up with recommendations, there's a subsequent process that will be necessary to implement their recommendations. And we're hoping that that will take no more than 3 to 4 months. But the county attorney's office has advised us that we include several phases here. The first being when we come to you all initially, once the recommendations have been made, just to present them to the P&Z and the board in a joint work session informally, so that you're aware of what recommendations have been made and where we're going from there. Then the Planning and Zoning Commission will be asked to amend the Pitkin County Comprehensive Plan to incorporate these recommendations for land use code amendments. And that, as you know, the Planning and Zoning Commission has the authority to adopt master plans, so that will be within their purview. And then concurrently, the Planning and Zoning Commission will look at land use code amendments and make a recommendation to the Board of County Commissioners to move forward with land use code amendments. So the next phase will be the Board of County Commissioners reviewing the land use code amendments as a final step for their adoption and implementation. And so then the last phase is board adopting those land use code amendments and implementing the recommendations of the committee to the extent that you choose to move in that direction.
Which is a full public process, et cetera.
Full, yes, each phase of this has a public hearing and public inclusion in the review process. And depending on how controversial some of these amendments may be, the time frame may either contract or expand as necessary to make sure that we're working with the public and dealing with any of the issues that are of concern.
And will be followed by fraught election campaigns.
Well, I was just surprised to see the advisory committee presenting to both P&Z and BOCC at the same time. I
Well,
thought it was going to go to P&Z first with the advice from the advisory group, P&Z, and then to BOCC. But obviously you want us to hear the same stuff they're hearing.
Yeah, and I think it was, initially, it was just to make both boards aware of what's been recommended and then take direction from the board ultimately moving forward with any amendments.
Okay. That might have to be in a big room. Okay.
Right. So I think that's what we've got, right?
Did we miss anything, you guys? When we talk about the ingredients, looking at those major aspects of the code, Kelly? Oh, okay. And then the agreements on the goals and what we're calling guardrails are, we're trying to stay within a certain realm. I mean, what we're asking, if you say, hey, come up with great quality of life in a community, it could go everywhere. But we know we have a task that we need to get accomplished. So we're trying to put some guardrails around it and saying we're focusing on residential, not commercial. We're focusing on including limitations and not just mitigation.
And incentives.
And now incentives. And, yeah.
So Cindy has two new words, if anybody notices, guardrails and recipe.
In
Recipe.
I noticed the recipe one for sure.
Yeah, the guardrails is the new
I'm
word.
not even a cook.
Okay. But you know your guardrails. Okay, I think Kelly and then Jeff.
I'm a cook. I like recipes better.
Yeah, you can take care of that.
I'm wondering, I feel like there could be value here from trying to bring in our municipal planning partners, because I envision like some conversation of like, what if we could land TDRs in the cities, or something like that. And
Been there,
I
done
just
that.
think there could be, and I'm sure there's others I'm not conceiving of right now. So I wonder if there's a place here for that.
We have
Really appreciate that.
They have
You're saying that.
offered and we have accepted, saying thank you, we'd like you to be part of our resource committee. We know that everybody's really busy, so we're not trying to have everybody come to every meeting, but, like the kickoff meeting might be a little bit more than
Just
they
wanted
need
to keep them all,
that kind of
snow mass,
thing.
basalt, aspen, keep them in the loop.
Right, but when we get into the meat of the issues, definitely, because that's part of the whole community.
Jeff and then Francie. Kelly, wait, are you?
I'm done. Thank you.
So and then Greg.
Greg.
So the question at the table was, did we miss any of the ingredients? And there's sort of a two-part answer. Over the past couple of years, we actually have updated multiple master plans where we have put additional constraints on house size. So other, the caucus areas, there's now 5 or so that now have limitations on house size. And they're not always coming back and saying greenhouse gas or climate. They're saying, well, we don't have the water resources because we only have a 4-inch pipe. So that's Brush Creek. And then we're the gateway to the Maroon Bells. And we don't want 15,000 square foot homes landed here either, because this is the natural wonder of the world. So I just want to add the missing ingredients would be rockfall, water. There's all these other levers that the communities are waking up and saying, we can't fight fires if we only have a 4-inch pipe. And so it's another way of not reducing it to an emotive, I think I could just build out 5750, it's like a use by right. But we have all these other physical constraints that are coming in, environmental constraints, and Brush Creek gladly said, yeah, 5750, done. We can't go above that because we can't sprinkler a home. And Maroon Creek came in and they actually updated the land use code with an overlay and said, this is not the character of our valley. And so that's, I think, what's changed in the past 2 years, in addition to adding sort of the economic arguments to this equation. Thank you.
Francie, and then Greg.
In terms of what Kelly said, is there any way we could ask the city to have one of the council people just be a part of, kind of like P&Z has 3 reps, could the city have a rep? I mean, is that something we could look at?
I don't know I don't know what the discussions have been with municipalities, but
So far, I've just spoken with our staff members and not invited council members to be part of it, but.
or members of their own P&Zs.
And Francie, I brought up the org chart here. The resource team in green down here, that is where our P&Z sits, and that's where the counterparts in municipality would also serve.
Okay, great.
So that is where we have them now, but that's, they're directors, not elected officials yet.
So there's an option, staff from the other, or
Okay.
electeds, or P&Z members from the other jurisdictions. So we have a little flexibility
Okay.
there.
Let us develop that a little more.
Greg, please.
Cindy, I just wanted to ask about historic. I see you've got history in there in your list, historic context. I think this is going to be super important as a reminder, if not as new information for this new advisory group. How did we get here? And it's not just the history of land use code, but, well, maybe it is, but what can you tell us about how the history will be presented? Because I think the history of the development of our valley and our community is going to be really important context for any ongoing, future discussion.
And I want to add to that the trials and tribulations, the successes and the not so successful attempts at previous land use code revisions. 2006 jumping to my mind for some reason. Those were always interesting meetings. So besides the freak power, which was very, it told the story, and it told the story in a great light, so. Let's see. Kara.
To Greg's point, I can say that we've brought on this great consultant named Cindy Hubin intentionally as part of to talk about the history of the land use pattern in meeting 1 or meeting 2 of the committee, because it's a wealth of knowledge, and I think I share those same things, and we've intentionally had built out the first couple of meetings for Cindy to be able to really speak about the land use pattern that has been developed over the past 30 years in the county. So I think that's really important.
Thanks, I feel better already.
We're in good hands. Okay, so we have missing ingredients, depends on what we're cooking. Goals and guardrails, it depends on how fast we're driving.
But,
Yeah. So, anything else?
I think that's it, right? You guys, thank you, and look, we're 15 minutes early.
I know, because I promised Francie I'd let her out early because she has a long drive, so.
Because you started us 15 minutes early today.
I started the whole day. I started the whole day really early. I got here at 8 o'clock.
So there's one thing I want to bring up that I might not have an opportunity to bring it up with the committee, and that is the fractional TDRs, which we've suggested that a couple times and we got resistance from your staff and Cindy. I think the committee should consider them, and my point being, if someone could buy, if they're going to buy a TDR that allows them to go to 8250, they're going to go to at least 8249 square feet. They're going to build the maximum. Maybe they don't want a house that big. Maybe they only want 650 square feet more. If they could buy a 1/4 of a fractional TDR and only build 650 square feet more than 5750, because that's what they want, and then that's their maximum they're allowed. A lot of people probably would go for that, so that's gonna lessen the house size that people are building to. And a half TDR would be 1,200 and.
I think that's gonna be part of the discussion.
So if that's part of the discussion, just for their consideration and try to figure that out, I think it would be a good tool to lessen the average house size.
Yeah, go
Joe,
ahead.
Joe Kraybacher or Monty Thompson, you get the last word today. Or Greg Postman gets the last word after your last word.
No,
Or
and Kelly's
Kelly.
got her hand up, so much for
So
15
Joe,
minutes.
so Joe or
I'm
Monty.
cutting this meeting at 6 o'clock, so. Joe,
I have nothing.
Monty.
I don't have any comments. I was just, listening, we'll get into it when we get into it.
And Chelsea as well, final?
Did she leave us?
Then over to Greg.
Greg, you have another comment before I?
Yeah,
Kelly.
I had a comment.
Did she say she had comments or no?
Jasmine's on.
Oh, Jasmine's on?
Jasmine, okay.
I actually don't have any comments, but
All
I
right.
was insulted at being overlooked.
Well, we didn't see you on the screen. Okay, we're gonna go to Greg and then Kelly.
The only thing I would add to this, and maybe it's already built in, is a check-in with somebody who really is up to speed on where we are with climate and carbon emissions. I'm not sure if our consultants are specifically going to be able to talk about carbon balances in the atmosphere, the gravity of the problem that we're perceiving here. But I think that that's an important thing to check in with the board at least once or twice during the during the whole thing, just so we can create the perspective and context for these conversations, because there are a lot of assumptions, there are a lot of there's a lot of information out there which may or may not be useful, but I think it would be helpful. Hopefully that helps. And that's all I have to say. Thanks.
Real quick, I'm gonna jump in, because going back to the 2019 levels, because of the discrepancies at 9% 2020, I wanna make sure we're not losing any ground. There's some things I think outside of COVID and the lack of people driving, we were already starting to work on this issue. And I wanna make sure we don't lose credit for where credit's deserved to be paid. So maybe 9%, maybe we need to look at what that figure should really be. Kelly.
Thanks. Yeah, I just, I think for me, this conversation started, if those of you but Francie will remember, at our board retreat. I think it was my first board retreat when we had a presentation from Holy Cross and Emery Levins, and then also had a conversation with George Newman about his interest in reducing maximum house size. And I think for me, it came together there of like, how are we intersecting this conversation about climate change with how we're using our land here? And I'm just excited about this conversation. Also feeling very urgent that we get it going and come back with some real action in these timelines, given the climate change crisis that we know and have declared as policy for the county. But I think this is also an opportunity for us to really set another standard, as Aspen and Picken County have done, because we're looking at how can you live a high quality life with a thriving economy while also reducing your climate change impact. And I think that is truly the goal we share and the vision that we share here. And I look forward to finding out what the recommendations are for bringing that to fruition. So just thanks. I really have enjoyed working with this P&Z.
We're not going to TDR, Steve.
No, this has to do with August 18th is the day of the CCI Mountain District meeting in
You don't mean.
Canyon City.
You're not involved in that meeting on the 18th.
No, aren't the BOCC invited to come to?
No.
We're not? And weren't you gonna do that, or at some point you were going to?
I thought that too, Steve.
The
Okay.
kickoff.
I thought
Okay,
so.
well,
Oh, I'm sorry, the kickoff, you
The
are
kickoff.
invited. You are invited
The
to that,
kickoff.
but not the other.
We're not changing the date of the kickoff
I'm
because
sorry.
one
So-
or two BOCC members can't be there.
I'm sorry, you are invited.
We're not changing
No.
the date of that.
I realize that, but if only, I already said I was going to the CCI Mountain District meeting. If nobody else goes, everybody else is at the kickoff meeting, and one of us, me, went to that.
You guys can decide that, but it doesn't matter. We don't technically need a quorum there, I don't think.
No, we don't, but I was just bringing it up with the BOCC.
I was planning on going.
I am
No.
not planning on going.
No,
I'm
not-
very much looking forward to the kickoff.
Me
So-
too. So
As opposed to
I'm going to
CCI.
go to the kickoff.
You're gonna go to
Here.
here, okay. Well,
So
I might too. I might just tell Eric
Yeah.
Bergman, sorry, I can't do it this time.
Yeah.
I'm gonna go to Hawaii and lay on the beach.
I'm going to go to Durango. Love you all. Thank you so very much.
All right, are we good?
Be safe.
Good. Anything else, Suzanne? It's always good to see you. It's always good
Wonderful,
having you at
always
the
to see
table.
you. I just, throughout this process, I thought it just, sometimes it just makes me want to cry with joy. To live in this community. I mean, look at what we're able to talk about, and the fact that a few people can still get a lot done because of our scale and because of the commitment and the values here. I'm so happy about
And
it.
even if sometimes we need to hold those feet to the fire, we do it in a gentle manner.
If we can.
Thank you. All right.
Thank you all.
Grassroots, thank you. Thank you to the public. Thank you, McCullough. Thank all of you. You guys
Thank
are
you
the
all.
best.
Thank you so much.